Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 165 NCLEX questions. Without delay, let's get started.
A nurse is admitting a patient to the cardiac unit who has stable angina and a history of type 2 diabetes mellitus. The patient is scheduled for a cardiac catheterization the next day. Which medication would need to be withheld for 24 hours before the procedure and for 48 hours after the procedure? 1. Glucophage. 2. Glimepiride. 3. Pravastatin. 4. Vitamin C. The correct answer is 1. Glucophage. Rationale: glucophage should be withheld 24 hours before and 48 hours after cardiac catheterization. Contrast medium is used during a cardiac catheterization and can affect kidney function, leaving the patient at an increased risk for lactic acidosis. The rest of the medications do not need to be withheld for longer than the recommended time that the patient would need to be NPO. Which topics will the nurse plan to include in discharge teaching for a patient who has been admitted with heart failure? Select all that apply. 1. How to monitor and record daily weight. 2. Importance of stopping exercise if heart rate increases. 3. Symptoms of worsening heart failure. 4. Purpose of chronic antibiotic therapy. 5. How to read food labels for sodium content. 6. Date and time for follow-up appointments. The correct answers are 1. How to monitor and record daily weight. 3. Symptoms of worsening heart failure. 5. How to read food labels for sodium content. And 6. Date and time for follow-up appointments. Rationale: to avoid rehospitalization, topics that should be included when discharging a patient with heart failure include how to maintain a low-sodium diet, the purpose and common side effects of medications, such as angiotensin-converting enzyme inhibitors and beta-blockers, what to do if symptoms of worsening heart failure occur, and the scheduling of follow-up appointments. The nurse will teach the patient that a moderate increase in heart rate and respiratory effort is normal with exercise. Antibiotics are not included in the treatment regimen for heart failure, which is not an infectious process. When the nurse is monitoring a 53-year-old patient who is undergoing a treadmill stress test, which finding will require the most immediate action? 1. Blood pressure of 152/88. 2. Heart rate of 134 beats per minute. 3. Oxygen saturation of 91%. 4. 3 premature ventricular contractions in a row. The correct answer is 4. 3 premature ventricular contractions in a row. Rationale: 3 PVCs in a row indicate non-sustained ventricular tachycardia and are an indication to stop the testing to avoid a worsening dysrhythmia. Moderate elevations in blood pressure and heart rate and slight decreases in oxygen saturation are a normal response to exercise and are expected during stress testing. A patient who has just arrived in the emergency department reports substernal and left arm discomfort that has been going on for about 3 hours. Which laboratory test will be most useful in determining whether the nurse should anticipate implementing the acute coronary syndrome standard protocol? 1. Creatine kinase MB level. 2. Troponin I level. 3. Myoglobin level. 4. C-reactive protein level. The correct answer is 2. Troponin I level. Rationale: cardiac troponin levels are elevated 3 hours after the onset of myocardial infarction and are very specific to cardiac muscle injury or infarction. Creatine kinase MB and myoglobin levels also increase with MI, but creatine kinase levels take at least 6 hours to increase, and myoglobin is nonspecific. Elevated C-reactive protein levels are a risk factor for coronary artery disease, but are not useful in detecting acute injury or infarction. The healthcare provider prescribes these actions for a patient who was admitted with acute substernal chest pain. Which actions are appropriate to assign to an experienced LPN/LVN who is working in the emergency department? Select all that apply. 1. Attaching cardiac monitor leads. 2. Giving heparin 5,000 units IV push. 3. administering morphine sulfate 4 mg IV. 4. Obtaining a 12-lead electrocardiogram. 5. Asking the patient about pertinent medical history. 6. Having the patient chew and swallow aspirin 162 mg. The correct answers are 1. Attaching cardiac monitor leads, 4. Obtaining a 12-lead electrocardiogram, and 6. Having the patient chew and swallow aspirin 162 mg. Rationale: attaching cardiac monitor leads, obtaining an ECG, and administering oral medications are within the scope of practice for LPN/LVNs. An experienced LPN/LVN would be familiar with these activities. Although anticoagulants and narcotics may be administered by LPNs/LVNs to stable patients, these are high-alert medications that should be given by the RN to this unstable patient. Obtaining a pertinent medical history requires RN-level education and scope of practice. The nurse makes a home visit to evaluate a hypertensive patient who has been taking enalapril. Which finding is most important to report to the healthcare provider? 1. Patient reports frequent urination. 2. Patient's blood pressure is 138/86. 3. Patient complains about a frequent dry cough. 4. Patient says, "I get dizzy sometimes if I stand up fast." The correct answer is 3. Patient complains about a frequent dry cough. Rationale: a persistent and irritating cough is a possible adverse effect of angiotensin-converting enzyme inhibitors, such as enalapril, and is a common reason for changing to another medication category, such as the angiotensin II receptor blockers. The other assessment data indicate a need for more patient teaching and ongoing monitoring, but would not require a change in therapy. Health history: denies any chronic health problems. Takes no medications currently. Physical exam: height 5 feet 6 inches. Weight 115 pounds. Body mass index 18.6. Social and diet history: works as an accountant. 1 glass of wine once or twice weekly. Eats fast food frequently. Based on this information in a patient's medical record, which topic is the highest priority for the nurse to include in the initial teaching plan for a 26-year-old patient who has blood pressures ranging from 150/84 to 162/90? 1. Symptoms of acute stroke and myocardial infarction. 2. Adverse effects of alcohol on blood pressure. 3. Methods for decreasing dietary caloric intake. 4. Low-sodium food choices when eating out. The correct answer is 4. Low-sodium food choices when eating out. Rationale: current guidelines recommend low-sodium intake for lifestyle management of hypertension, and the nurse should teach the patient about the high sodium content in many fast foods and how to make low-sodium choices. A 26-year-old with this level of hypertension is not likely to have a stroke or myocardial infarction. Weight loss or changes in alcohol intake are not necessary. The patient's weight and BMI are normal. Alcohol intake of less than 1 or 2 glasses of wine daily is recommended to prevent hypertension. The nurse is assessing a patient with a neurologic health problem and discovers a change in level of consciousness from alert to lethargic. What is the nurse's best action? 1. Perform a complete neurological assessment. 2. Assess the cranial nerve functions. 3. Contact the rapid response team. 4. Reassess the patient in 30 minutes. The correct answer is 3. Contact the rapid response team. Rationale: a change in level of consciousness and orientation is the earliest and most reliable indication that central neurologic function has declined. If a decline occurs, the nurse should contact the rapid response team or healthcare provider immediately. The nurse should also perform a focused assessment to determine if there are any other changes. The nurse in the ER assesses a 21-year-old new admission who was in a motor vehicle crash. On assessment, the nurse discovers the patient has the pictured manifestation. Which injury does this finding indicate to the nurse? 1. Frontal skull fracture. 2. Basilar skull fracture. 3. Orbital fracture. 4. Temporal fracture. The correct answer is 2. Basilar skull fracture. Rationale. The location of a fracture determines the signs and symptoms that develop over several hours. This figure shows battle sign, which is a common clinical sign for a basilar skull fracture. Another sign of this type of fracture is raccoon eyes. It is usually accompanied by a tear in the dura with leaking of cerebrospinal fluid, so rhinorrhea or otorrhea are also present. The other three types of fracture have different signs, depending on the location. What is the priority nursing concern for a patient experiencing a migraine headache? 1. Pain. 2. Anxiety. 3. Hopelessness. 4. Risk of brain injury. The correct answer is 1. Pain. Rationale. The priority for interdisciplinary care for the patient experiencing a migraine headache is pain management. All of the other problems are accurate, but none of them is as urgent as the issue of pain, which is often incapacitating. The nurse on the neurologic acute care unit is assessing the orientation of a patient with severe headaches. Which questions would the nurse use to determine orientation? Select all that apply. 1. When did you first experience the headache symptoms? 2. Did the mayor of Cleveland run as a Democrat or Republican? 3. What is your health care provider's name? 4. What year and month is it? 5. What is the address of your parents' house? 6. What is the name of this health care facility? The correct answers are 1. When did you first experience the headache symptoms? 3. What is your health care provider's name? 4. What year and month is it? And 6. What is the name of this health care facility? Rationale. After determining alertness in a patient, the next step is to evaluate orientation. When the patient's attention is engaged, ask him or her questions to determine orientation. Varying the sequence of questioning on repeated assessments prevents the patient from memorizing the answers. Responses that indicate orientation include the ability to answer questions about person, place, and time, so the nurse should ask for information relating to the onset of the patient's symptoms, the name of his or her healthcare provider, the year and month, his or her address, and the name of the referring physician or healthcare agency. Asking about the mayor's affiliation, or for his or her parents' address, may be inappropriate to assess orientation. The nurse is creating a teaching plan for a patient with newly diagnosed migraine headaches. Which key items will be included in the teaching plan? Select all that apply. 1. Foods that contain tyramine, such as alcohol and aged cheese, should be avoided. 2. Drugs such as nitroglycerin and nifedipine should be avoided. 3. Abortive therapy is aimed at eliminating the pain during the aura. 4. A potential side effect of medications is rebound headache. 5. Complementary therapies such as biofeedback and relaxation may be helpful. 6. Estrogen therapy should be continued as prescribed by the patient's health care provider. The correct answers are 1. Foods that contain tyramine, such as alcohol and aged cheese, should be avoided. 2. Drugs such as nitroglycerin and nifedipine should be avoided. 3. Abortive therapy is aimed at eliminating the pain during the aura. 4. A potential side effect of medications is rebound headache. And 5. Complementary therapies such as biofeedback and relaxation may be helpful. Rationale. Medications such as estrogen supplements may actually trigger a migraine headache attack and should be avoided. All of the other statements are accurate and should be included in the teaching plan. The charge nurse is preparing to admit a patient with a seizure disorder. Which action can be assigned to an LPN/LVN? 1. Completing the admission assessment. 2. Setting up oxygen and suction equipment. 3. Placing a padded tongue blade at the bedside. 4. Patting the side rails before the patient arrives. The correct answer is 2. Setting up oxygen and suction equipment. Rationale. The LPN/LVN scope of practice includes setting up the equipment for oxygen and suctioning. The RN should perform the complete initial assessment. Controversy exists as to whether padded side rails actually provide safety, and their use may embarrass the patient and family. Tongue blades should never be at the bedside and should never be inserted into the patient's mouth after a seizure begins. After a patient has a seizure, which action can the nurse delegate to the assistive personnel? 1. Documenting the seizure. 2. Performing neurological checks. 3. Checking the patient's vital signs. 4. Restraining the patient for protection. The correct answer is 3. Checking the patient's vital signs. Rationale. Measurement of vital signs is within the education and scope of practice of APs. The nurse should perform neurological checks and document the seizure. Patients with seizures should not be restrained, however, the nurse may guide the patient's movements, if necessary, to prevent injury. A nursing student is teaching a patient and family about epilepsy before the patient's discharge. For which statement should the nurse intervene? 1. You should avoid consumption of all forms of alcohol. 2. Wear your medical alert bracelet at all times. 3. Protect your loved one's airway during a seizure. 4. It's okay to take over-the-counter medications. The correct answer is 4. It's okay to take over-the-counter medications. Rationale. A patient with a seizure disorder should not take over-the-counter medications without consulting with the health care provider first. The other 3 statements are appropriate teaching points for patients with seizure disorders and their families. The nurse is preparing to discharge a patient with chronic low back pain. Which statement by the patient indicates the need for additional teaching? 1. I will avoid exercise because the pain gets worse. 2. I will use heat or ice to help control the pain. 3. I will not wear high-heeled shoes at home or work. 4. I will purchase a firm mattress to replace my old one. The correct answer is 1. I will avoid exercise because the pain gets worse. Rationale. Exercises are used to strengthen the back, relieve pressure on compressed nerves, and protect the back from re-injury. Ice, heat, and firm mattresses are appropriate interventions for back pain. People with chronic back pain should avoid wearing high-heeled shoes at all times. A patient with Parkinson's disease has a problem with decreased mobility related to neuromuscular impairment. The nurse observes the assistive personnel performing all of these actions. For which action must the nurse intervene? 1. Helping the patient ambulate to the bathroom and back to bed. 2. Reminding the patient not to look at his feet when he is walking. 3. Performing the patient's complete bathing and oral care. 4. Setting up the patient's tray and encouraging the patient to feed himself. The correct answer is 3. Performing the patient's complete bathing and oral care. Rationale. Although all of these actions fall within the scope of practice for an AP, the AP should help the patient with morning care as needed, but the goal is to keep the patient as independent and mobile as possible. The patient should be encouraged to perform as much morning care as possible. Assisting the patient in ambulating, reminding the patient not to look at his feet, and encouraging the patient to feed himself are all appropriate to the goal of maintaining independence. A patient with a spinal cord injury reports a sudden severe throbbing headache that started a short time ago. Assessment of the patient reveals increased blood pressure of 168/94 and decreased heart rate of 48 beats per minute, diaphoresis, and flushing of the face and neck. What action should the nurse take first? 1. Administer the ordered acetaminophen. 2. Check the indwelling catheter tubing for kinks or obstruction. 3. Adjust the temperature in the patient's room. 4. Notify the health care provider about the change in status. The correct answer is 2. Check the indwelling catheter tubing for kinks or obstruction. Rationale. The patient's signs and symptoms are characteristic of autonomic dysreflexia, a neurological emergency that must be promptly treated to prevent a hypertensive stroke. The cause of this syndrome is noxious stimuli, most often a distended bladder or constipation, so checking for poor catheter drainage, bladder distension, and fecal impaction is the first action that should be taken. Adjusting the room temperature may be helpful because too cool of a temperature in the room may contribute to the problem. Acetaminophen will not decrease the autonomic dysreflexia that is causing the patient's headache. Notifying the HCP may be necessary if nursing actions do not resolve symptoms. The nurse is floated from the emergency department to the neurologic floor. Which action should the nurse delegate to the assistive personnel when providing nursing care for a patient with a spinal cord injury? 1. Assessing the patient's respiratory status every 4 hours. 2. Checking and recording the patient's vital signs every 4 hours. 3. Monitoring the patient's nutritional status, including calorie counts. 4. Instructing the patient how to turn, cough, and breathe deeply every 2 hours. The correct answer is 2. Checking and recording the patient's vital signs every 4 hours. Rationale. The AP's training and education covers measuring and recording vital signs. The AP may help with turning and repositioning the patient, and may remind the patient to cough and deep breathe, but he or she does not teach the patient how to perform these actions. Assessing and monitoring patients require additional education and are appropriate to the scope of practice of professional nurses. A patient with a spinal cord injury at level C3 to C4 is being cared for by the nurse in the emergency department. What is the priority nursing assessment? 1. Determine the level at which the patient has intact sensation. 2. Assess the level at which the patient has retained mobility. 3. Check blood pressure and pulse for signs of spinal shock. 4. Monitor respiratory effort and oxygen saturation level. The correct answer is 4. Monitor respiratory effort and oxygen saturation level. Rationale. The first priority for the patient with a spinal cord injury is assessing respiratory patterns and ensuring an adequate airway. A patient with a high cervical injury is at risk for respiratory compromise because spinal nerves C3 through C5 innervate the phrenic nerve, which controls the diaphragm. The other assessments are also necessary, but are not as high a priority. The nurse is helping a patient with a spinal cord injury to establish a bladder retraining program. Which strategies may stimulate the patient to void? Select all that apply. 1. The stroking of the inner thigh. 2. The pulling of pubic hair. 3. Initiating intermittent straight catheterization. 4. Tapping the bladder to stimulate the detrusor muscle. 5. Reminding the patient to void in a urinal every hour while awake. The correct answers are 1. The stroking of the inner thigh, 2. The pulling of pubic hair, and 4. Tapping the bladder to stimulate the detrusor muscle. Rationale. All of the strategies except straight catheterization may stimulate voiding in patients with an SCI. Intermittent bladder catheterization can be used to empty the patient's bladder, but it will not stimulate voiding. To use a urinal, the patient must have bladder control, which is often absent after an SCI. In addition, every hour while awake would be too often, and would ignore the bladder filling at night. Which patient should the charge nurse assign to the traveling nurse, new to neurologic nursing care, who has been on the neurologic unit for 1 week? 1. A 34-year-old patient with newly diagnosed multiple sclerosis. 2. A 68-year-old patient with chronic amyotrophic lateral sclerosis. 3. A 56-year-old patient with Guillain-Barré syndrome in respiratory distress. 4. A 25-year-old patient admitted with AC4 level spinal cord injury. The correct answer is 2. A 68-year-old patient with chronic amyotrophic lateral sclerosis. Rationale. The traveling nurse is relatively new to neurologic nursing and should be assigned patients whose condition is stable and not complex, such as the patient with chronic ALS. The newly diagnosed patient with MS will need a lot of teaching and support. The patient with GBS and respiratory distress will need frequent assessments and may need to be transferred to the intensive care unit. The patient with AC4 level SCI is at risk for respiratory arrest. All three of these patients should be assigned to nurses experienced in neurologic nursing care. A patient with a cervical spinal cord injury has been placed in fixed skeletal traction with a halo fixation device. When caring for this patient, the charge nurse may assign which actions to the LPN/LVN. Select all that apply. 1. Checking the patient's skin for pressure from the device. 2. Assessing the patient's neurologic status for changes. 3. Observing the halo insertion sites for signs of infection. 4. Cleaning the halo insertion sites with hydrogen peroxide. 5. Developing the nursing plan of care for the patient. 6. Administering oral medications as prescribed. The correct answers are 1. Checking the patient's skin for pressure from the device. 3. Observing the halo insertion sites for signs of infection. 4. Cleaning the halo insertion sites with hydrogen peroxide. And 6. Administering oral medications as prescribed. Rationale. Checking and observing for signs of pressure or infection is within the scope of practice of the LPN/LVN. The LPN/LVN also has the appropriate skills for cleaning the halo insertion sites with hydrogen peroxide. Administering oral drugs is within the scope of practice for an LPN/LVN. Neurologic examination and care plan development require additional education and skill appropriate to the professional RN. The critical care nurse is assessing a patient whose baseline Glasgow Coma Scale score in the emergency department was 5. The current GCS score is 3. What is the nurse's best interpretation of this finding? 1. The patient's condition is improving. 2. The patient's condition is deteriorating. 3. The patient will need intubation and mechanical ventilation. 4. The patient's medication regime will need adjustments. The correct answer is 2. The patient's condition is deteriorating. Rationale. The GCS is used in many acute care settings to establish baseline data in these areas: eye-opening, motor response, and verbal response. The patient is assigned a numeric score for each of these areas. The lower the score, the lower the patient's neurological function. A decrease of 2 or more points in the Glasgow Coma Scale score total is clinically significant and should be communicated to the healthcare provider immediately. The nurse notes that a patient with myasthenia gravis has an elevated temperature of 102.2 degrees Fahrenheit, an increased heart rate of 120 beats per minute, and a rise in blood pressure of 158/94, and is incontinent of urine and stool. What is the nurse's best action at this time? 1. Administer an acetaminophen suppository. 2. Notify the healthcare provider immediately. 3. Recheck vital signs in 1 hour. 4. Reschedule the patient's physical therapy. The correct answer is 2. Notify the healthcare provider immediately. Rationale. The changes that the nurse notes are characteristic of myasthenic crisis, which often follows some type of infection. The patient is at risk for inadequate respiratory function. In addition to notifying the HCP, or Rapid Response Team, the nurse should carefully monitor the patient's respiratory status. The patient may need intubation and mechanical ventilation. An LPN/LVN, under the RN supervision, is assigned to provide nursing care for a patient with Guillain-Barré syndrome. What observation should the LPN/LVN be instructed to report immediately? 1. Reports of numbness and tingling. 2. Facial weakness and difficulty speaking. 3. Rapid heart rate of 102 beats per minute. 4. Shallow respirations and decreased breath sounds. The correct answer is 4. Shallow respirations and decreased breath sounds. Rationale. The priority intervention for a patient with GBS is maintaining adequate respiratory function. Patients with GBS are at risk for respiratory failure, which requires urgent intervention. The other findings are important and should be reported to the nurse, but they are not life-threatening.
A 21-year-old woman at 8 weeks gestation tells the nurse she has obtained marijuana from the town's marijuana dispensary to help her with the nausea she is experiencing. Which action would be the priority? 1. Inform the patient that there are other treatments for nausea in pregnancy. 2. Advise the patient that marijuana may have deleterious effects on the neurologic development of the fetus. 3. Teach the patient that inhaled marijuana will have a more rapid effect than edible marijuana products. 4. Inform the patient that marijuana is thought to be an effective remedy for nausea. The correct answer is 2. Advise the patient that marijuana may have deleterious effects on the neurologic development of the fetus. There is evidence that marijuana used during pregnancy can be linked to impaired neurologic development in the fetus and learning and behavioral issues in the child exposed to marijuana in the prenatal period. The first priority would be to prevent harm and to begin educating the mother of the potential risks of marijuana use in pregnancy. It would then be appropriate to provide information to her of other potential treatments for her nausea. The goal would be to educate the woman of the risks and to provide an alternative, safer treatment. It is true that inhaled marijuana will have a quicker action and that some studies have found marijuana to be effective in the treatment of nausea. However, that is not priority information for her at this time. A 30-year-old woman with type 1 diabetes mellitus comes to the clinic for preconception care. Which information would be the priority to communicate to her at this time? 1. Her insulin requirements will likely increase during the second and third trimesters of pregnancy. 2. Infants of mothers with diabetes can be macrosomic, which can result in a more difficult delivery and a higher likelihood of cesarean section. 3. Breastfeeding is highly recommended, and insulin use is not a contraindication. 4. Achievement of optimal glycemic control at this time is of utmost importance in preventing congenital anomalies. The correct answer is 4. Achievement of optimal glycemic control at this time is of utmost importance in preventing congenital anomalies. The incidence of congenital anomalies is 3 times higher in the offspring of women with diabetes. Good glycemic control during preconception and early pregnancy significantly reduces this risk and would be the highest priority message to this patient at this point. The other responses are correct, but are not of greatest importance at this time. A 19-year-old Gravida 1, para 0 patient at 40 weeks gestation who is in labor is being treated with magnesium sulfate for seizure prophylaxis in preeclampsia. Which are priority assessments with this medication? Select all that apply. 1. Check deep tendon reflexes. 2. Observe for vaginal bleeding. 3. Check the respiratory rate. 4. Note the urine output. 5. Monitor for calf pain. 6. Watch for early fetal heart rate decelerations. The correct answers are 1. Check deep tendon reflexes. 3. Check the respiratory rate. And 4. Note the urine output. Magnesium sulfate toxicity can cause fatal cardiovascular events or respiratory depression or arrest, so monitoring of the respiratory rate is of utmost importance. The drug is excreted by the kidneys, and therefore monitoring for adequate urine output is essential. Deep tendon reflexes disappear when serum magnesium is reaching a toxic level. Vaginal bleeding is not associated with magnesium sulfate use. Calf pain can be a sign of a deep vein thrombosis, but is not associated with magnesium sulfate therapy. Early fetal heart rate decelerations are not associated with use of magnesium sulfate. A 24-year-old Gravida 2, para 1 woman is being admitted in active labor at 39 weeks gestation. Which prenatal data would be most important for the nurse to address at this time? 1. Hemoglobin level of 11 grams per deciliter at 28 weeks gestation. 2. Positive result on test for Group B streptococci at 36 weeks gestation. 3. Urinary tract infection with Escherichia coli treated at 20 weeks gestation. 4. Elevated level on glucose screening test at 28 weeks gestation, followed by normal 3-hour glucose tolerance test results at 29 weeks gestation. The correct answer is 2. Positive result on test for Group B streptococci at 36 weeks gestation. The positive Group B streptococci result requires immediate action. The healthcare provider must be notified, and orders obtained for prompt antibiotic prophylaxis during labor to reduce the risk of mother-to-newborn transmission of Group B streptococci. The other data are not as significant in the care of the patient at this moment. Intrapartum appropriate antibiotic treatment of the mother with Group B streptococci supports the perinatal core measure of reducing healthcare-acquired bloodstream infections in newborns. The telephone triage nurse in the prenatal clinic receives the following calls. Which telephone call would require immediate notification of the healthcare provider? 1. Patient reports leaking vaginal fluid at 34 weeks gestation. 2. Patient reports nausea and vomiting at 8 weeks gestation. 3. Patient reports pedal edema at 39 weeks gestation. 4. Patient reports vaginal itching at 20 weeks gestation. The correct answer is 1. Patient reports leaking vaginal fluid at 34 weeks gestation. Leaking vaginal fluid at 34 weeks gestation requires immediate attention because it could indicate premature rupture of membranes with the risk of premature birth. A nurse in a prenatal clinic can safely give telephone advice regarding nausea, vomiting, and pedal edema, which can be considered normal in pregnancy. The nurse would assess the complaint, give the patient evidence-based advice, and define the circumstances under which the patient should call back. Vaginal itching at 20 weeks gestation could indicate a yeast infection. Depending on clinic protocols, the nurse could, after phone assessment, safely recommend an over-the-counter medication or arrange an office visit for the patient. The nurse is caring for a patient in labor at 39 weeks gestation and has identified mild variable fetal heart rate decelerations. Which action would the nurse take first? 1. Change the maternal position. 2. Notify the healthcare provider. 3. Prepare for delivery. 4. Readjust the fetal monitor. The correct answer is 1. Change the maternal position. The cause of variable fetal heart decelerations is compression of the umbilical cord, which can often be corrected by a change in maternal position. It is usually a benign condition and would not require the nurse to prepare for delivery or to notify the healthcare provider unless the variable decelerations are severe and persistent. Adjusting the fetal monitor may be needed after the change in maternal position, but would not directly address the variable decelerations. A 24-year-old Gravida 1 para-0 patient is receiving oxytocin during her labor at 41 weeks gestation. Which nursing actions are appropriate when late fetal heart rate decelerations are identified? Select all that apply. 1. Discontinue the oxytocin. 2. Decrease the maintenance IV fluid rate. 3. Administer oxygen to the mother by mask. 4. Place the woman in high Fowler position. 5. Notify the healthcare provider. 6. Discontinue epidural anesthesia. The correct answers are 1. Discontinue the oxytocin. 3. Administer oxygen to the mother by mask. And 5. Notify the healthcare provider. Late fetal heart rate decelerations can be an ominous sign of fetal hypoxemia, especially if repetitive and accompanied by decreased variability. Notification of the HCP is indicated. Turning off the oxytocin and administering oxygen to the mother are recommended nursing interventions to improve fetal oxygenation. An increase, not a decrease, in the IV rate can improve hydration, correct hypovolemia, and increase blood flow to the uterus. Putting the woman in a lateral position can increase blood flow to the uterus and increase oxygenation to the fetus. The high Fowler position would not be helpful. Discontinuation of epidural anesthesia would not be indicated in the presence of late fetal heart rate decelerations. The anesthesia may be vitally important if the condition continues or worsens and necessitates a cesarean section. Promptly addressing fetal heart rate changes may allow intrauterine resuscitation and may decrease the need for cesarean section if those measures are effective. This supports the perinatal core measure of reducing cesarean section rates. A pregnant woman at 12 weeks gestation tells the nurse that she is a vegetarian. Which action would the nurse take first? 1. Recommend vitamin B12 and iron supplementation. 2. Recommend consumption of protein drinks daily. 3. Obtain a 24-hour diet recall history. 4. Determine the reason for her vegetarian diet. The correct answer is 3. Obtain a 24-hour diet recall history. The care of a vegetarian woman who is pregnant should begin with an assessment of her diet because vegetarian practices vary widely. The nurse must first assess exactly what the woman's diet consists of and then determine any deficiencies. It is probable that the woman will need a vitamin B12 supplement, but the assessment comes first. Vegetarian diets can be completely adequate in protein, and therefore protein supplementation is not routinely recommended. The reason for the diet is less important than what the diet actually contains. Which action by a newly graduated nurse during a delivery complicated by shoulder dystocia would require immediate correction by the nurse who is orienting her? 1. Applying fundal pressure. 2. Applying suprapubic pressure. 3. Requesting the immediate presence of the neonatologist. 4. Flexing the maternal legs back across the maternal abdomen. The correct answer is 1. Applying fundal pressure. Fundal pressure should never be applied in a case of shoulder dystocia because it may worsen the problem by impacting the fetal shoulder even more firmly into the symphysis pubis. This issue of patient safety would require the supervising nurse to intervene immediately. The other responses are appropriate actions in a case of shoulder dystocia. A 27-year-old patient underwent a primary cesarean section because of breech presentation 24 hours ago. Which assessment finding would be of the most concern? 1. Small amount of lochia rubra. 2. Temperature of 99 degrees Fahrenheit. 3. Slight redness and pain of the left calf. 4. Pain rated as 3 of 10 in the incisional area. The correct answer is 3. Slight redness and pain of the left calf. Slight redness and pain in the left calf could be suggestive of thrombophlebitis and requires further investigation. The other findings are within normal limits for this point in the postpartum and post-operative course. A 36-year-old Gravida 1, Para 0, patient has received an epidural anesthetic. Her cervix is 6 centimeters dilated. Her blood pressure is currently 60/38. Which nursing actions would be the priority? Select all that apply. 1. Place the patient in high Fowler position. 2. Turn the patient to a lateral position. 3. Notify the anesthesiologist. 4. Prepare for emergency cesarean section. 5. Decrease the IV fluid rate. 6. Observe closely for fetal heart rate decelerations. The correct answers are 2. Turn the patient to a lateral position. 3. Notify the anesthesiologist. And 6. Observe closely for fetal heart rate decelerations. The patient may be experiencing supine hypotension caused by the pressure of the uterus on the vena cava and the effects of the epidural medication. Maternal hypotension can cause uteroplacental insufficiency, leading to fetal hypoxia. Placing the woman in a lateral position can relieve the pressure on the vena cava. The anesthesiologist should be notified and may need to treat the patient with ephedrine to correct the hypotension. Fetal heart rate decelerations are common if maternal hypotension is not promptly corrected. IV fluids are increased per protocol when supine hypotension occurs. A 25-year-old Gravida 2, Para 1 patient has come to the obstetric triage room at 32 weeks gestation, reporting painless vaginal bleeding. The nurse is providing orientation for a new nurse on the unit. Which statement by the new nurse to the patient would require the nurse to promptly intervene? 1. I'm going to check your vital signs. 2. I'm going to apply a fetal monitor to check the baby's heart rate and to see if you are having contractions. 3. I'm going to perform a vaginal examination to see if your cervix is dilated. 4. I'm going to feel your abdomen to check the position of the baby. The correct answer is 3. I'm going to perform a vaginal examination to see if your cervix is dilated. Painless vaginal bleeding can be a symptom of placenta previa. A digital vaginal examination is contraindicated until ultrasonography can be performed to rule out placenta previa. If a digital examination is performed when placenta previa is present, it can cause increased bleeding. The other statements reflect appropriate assessment of an incoming patient with vaginal bleeding. A 3-month-old infant arrives at the health center for a scheduled well child visit. The parents ask the nurse why the infant extends the arms and legs in response to a loud sound. Which response by the nurse is best? 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. 2. Tell the parents if the behavior does not change by 6 months, the infant will need further evaluation. 3. Remind the parents this is a normal response that indicates the infant's hearing is intact. 4. Reassure the parents that the behavior is normal and not an indicator of any problem such as cerebral palsy. The correct answer is 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. The infant's behavior is consistent with the Moro and startle reflexes. The Moro reflex usually disappears by 6 months of age. The startle reflex usually disappears by 4 months of age. A hearing test is not based on response to loud sounds alone. Although it is true that further evaluation may be needed if the reflexes do not disappear, there is no need for the nurse to discuss this with the parents at this time. The infant's behavior is not consistent with cerebral palsy. A 6-year-old child who received chemotherapy and had anorexia is now cheerfully eating peanut butter, yogurt, and applesauce. When the mother arrives, the child refuses to eat and throws the dish on the floor. What is the nurse's best response to this behavior? 1. Remind the child that foods tasted good today and will help her or his body to get strong. 2. Allow the mother and child time alone to review and control the behavior. 3. Ask the mother to leave until the child can finish eating and then invite her back. 4. Explain to the mother that the behavior could be a normal expression of anger. The correct answer is 4. Explain to the mother that the behavior could be a normal expression of anger. Help the mother to understand that the child may be angry about being left in the hospital or about her inability to prevent the illness and protect the child. Reminding the child about the food and the purpose of the food does not address the strong emotions underlying the outburst. Allowing the mother and child time alone is a possibility, but the assumption would be that the mother understands the child's behavior and is prepared to deal with the behavior in a constructive manner. Asking the mother to leave the child suggests that the mother is a source of stress. An 18-month-old child has oral mucositis secondary to chemotherapy. Which task should the nurse delegate to the assistive personnel? 1. Reporting evidence of severe mucosal ulceration. 2. Assisting the child in swishing and spitting mouthwash. 3. Assessing the child's ability and willingness to drink through a straw. 4. Feeding the child a bland, moist, soft diet. The correct answer is 4. Feeding the child a bland, moist, soft diet. Helping the child to eat is within the scope of responsibilities for an AP. Assessing ability and willingness to drink and checking for extent of mucosal ulceration are the responsibilities of a nurse. An 18-month-old child is not able to swish and spit, which could result in swallowing the mouthwash. Mouthwash is not intended for swallowing because it can contain alcohol and other ingredients not safe for ingestion. The pediatric unit charge nurse is making patient assignments for the evening shift. Which patient is most appropriate to assign to an experienced LPN/LVN? 1. A 1-year-old patient with severe combined immunodeficiency disease who is scheduled to receive chemotherapy in preparation for a stem cell transplant. 2. A 2-year-old patient with Wiskott-Aldrich syndrome who has orders for a platelet transfusion. 3. A 3-year-old patient who has chronic graft-versus-host disease and is incontinent of loose stools. 4. A 6-year-old patient who received chemotherapy 1 week ago and is admitted with increasing lethargy and a temperature of 101 degrees Fahrenheit. The correct answer is 3. A 3-year-old patient who has chronic graft-versus-host disease and is incontinent of loose stools. LPN/LVN scope of practice includes the care of patients with chronic and stable health problems, such as the patient with chronic graft-versus-host disease. Chemotherapy medications are considered high-alert medications and should be given by RNs who have received additional education in chemotherapy administration. Platelets and other blood products should be given by RNs. The 6-year-old patient has a history and clinical manifestations consistent with neutropenia and sepsis and should be assessed by an RN as quickly as possible. A 4-month-old infant boy is brought to the emergency department by his parents. He has been vomiting and fussy for the past 24 hours. On examination, there are circular bruises on his back. What priority assessment does the nurse anticipate? 1. Chest X-ray examination. 2. Ultrasonography of the head. 3. Electroencephalography. 4. Ophthalmologic examination. The correct answer is 4. Ophthalmologic examination. The history and physical examination suggest shaken baby syndrome. An ophthalmologic examination is indicated to determine if the infant has retinal hemorrhages characteristic of shaken baby syndrome. Electroencephalography may be indicated if there is evidence of seizures. Magnetic resonance imaging or computed tomography of the head can detect subdural hematomas. There is no evidence that would support the need for a chest X-ray examination. The nurse is preparing to care for a 6-year-old child who has just undergone allogenic stem cell transplantation. Which nursing tasks should the nurse delegate to the assistive personnel? Select all that apply. 1. Stocking the child's room with standard personal protective equipment items. 2. Teaching the child to perform thorough hand washing after using the bathroom. 3. Reminding the child to wear a face mask outside of the hospital room. 4. Assessing the child's oral cavity for signs and symptoms of infection. 5. Talking to the family members about the ways to reduce risk of infection. 6. Talk to the parents about local community and healthcare resources that will support the family after discharge. The correct answers are 1. Stocking the child's room with standard personal protective equipment items, and 3. Reminding the child to wear a face mask outside of the hospital room. Because all patient care staff members should be familiar with standard personal protective equipment, an AP will be able to stock the room. Reminding the child to wear a face mask is also a task that can be done by an AP, although the nurse is responsible for the initial teaching. Initially, teaching the child a good hand-washing technique, nursing assessments, and family education is within the scope of the nurse and not an AP. Talking to the family about local resources post-discharge should be done by either the nurse or the social services department. While working in the pediatric clinic, the nurse receives a telephone call from the parent of a 13-year-old child who is receiving chemotherapy for leukemia. The patient's sibling has chickenpox. Which action will the nurse anticipate taking next? 1. Administer varicella-zoster immune globulin to the patient. 2. Teach the parent about the correct use of acyclovir. 3. Educate the parent about contact and airborne precautions. 4. Prepare to admit the patient to a private room in the hospital. The correct answer is 1. Administer varicella-zoster immune globulin to the patient. The administration of varicella-zoster immune globulin can prevent the development of varicella in immunosuppressed patients and will typically be prescribed. Acyclovir therapy and hospitalization may be required if the child develops a varicella-zoster virus infection. Contact and airborne precautions will be implemented to prevent the spread of infection to other children if the child is hospitalized with varicella. The school nurse is performing developmental screenings for children who will be entering preschool. A 4-year-old girl excitedly tells the nurse about her recent birthday party. As she relates the details of the event, she frequently stutters. Which action by the nurse is most appropriate at this time? 1. Refer the child to an audiologist. 2. Obtain a detailed birth history from the parents. 3. Document the findings on the child's school record. 4. Refer the child to a speech pathologist. The correct answer is 3. Document the findings on the child's school record. Stuttering during the preschool years is a normal variation, particularly when excited or upset. The cause is attributed to preschool children increased cognitive abilities and imagination, such that their speech cannot keep up with their thoughts. Documenting this on the child's record is important for continued observation to determine if it extends beyond the preschool years. The nurse has obtained this assessment information about a 3-year-old patient who has just returned to the pediatric unit after having a tonsillectomy. Which finding requires the most immediate follow-up? 1. Frequent swallowing. 2. Hypotonic bowel sounds. 3. Reports of a sore throat. 4. Heart rate of 112 beats per minute. The correct answer is 1. Frequent swallowing. Frequent swallowing after a tonsillectomy may indicate bleeding. The nurse should inspect the back of the throat for evidence of bleeding. The other assessment results are expected in a 3-year-old child after surgery. The nurse is providing nursing care for a newborn infant with respiratory distress syndrome who is receiving nasal continuous positive airway pressure ventilation. Which assessment finding is most important to report to the healthcare provider? 1. Apical pulse rate of 156 beats per minute. 2. Crackles audible in both lungs. 3. Tracheal deviation to the right. 4. Oxygen saturation of 93%. The correct answer is 3. Tracheal deviation to the right. Tracheal deviation suggests tension pneumothorax, a possible complication of positive pressure ventilation. The nurse will need to communicate rapidly with the HCP and assist with actions such as chest tube insertion. The heart rate, crackles, and oxygen saturation will be reported to the HCP but are expected in RDS and do not require immediate intervention. The nurse is assisting with the delivery of a 31-week gestational age premature newborn who requires intubation for respiratory distress syndrome. Which medication does the nurse anticipate will be needed first for this infant? 1. Theophylline. 2. Surfactant. 3. Dexamethasone. 4. Albuterol. The correct answer is 2. Surfactant. Research indicates that the administration of synthetic surfactant improves respiratory status and decreases the incidence of pneumothorax in premature infants with RDS. The other medications may be used if respiratory distress persists, but the first medication administered will be the surfactant. The nurse is observing a preschool classroom of children between the ages of 3 to 4 years of age. When planning actions to ensure that each child meets normal developmental goals, which child will require the most immediate intervention? 1. A 3-year-old boy who needs help dressing. 2. A 4-year-old girl who has an imaginary friend. 3. A 4-year-old girl who engages only in parallel play. 4. A 3-year-old boy who draws stick figures. The correct answer is 3. A 4-year-old girl who engages only in parallel play. At 4 years of age, children engage in pretend play. Parallel play is seen in younger children between the ages of 2 and 3 years when they play side by side with limited interaction. The other behaviors are developmentally appropriate. The nurse will plan interventions to ensure that all the children meet developmental goals, but the 4-year-old child engaging only in parallel play will require the most immediate intervention. The nurse is obtaining the history and physical information for a child who is recovering from Kawasaki disease and receives aspirin therapy. Which information concerns the nurse the most? 1. The child attends a daycare center 5 days a week. 2. The child's fingers have areas of peeling skin. 3. The child is very irritable and cries frequently. 4. The child has not received any immunizations. The correct answer is 4. The child has not received any immunizations. Children who receive aspirin therapy are at risk for the development of Reye syndrome if they contract viral illnesses such as varicella or influenza, so the lack of immunization is the greatest concern for this child. Peeling skin on the fingers and toes and irritability are consistent with Kawasaki disease, but do not require any change in therapy. Because Kawasaki disease is not a communicable disease, there is no risk for transmission to other children in the daycare. The nurse has just received a change of shift report about these pediatric patients. Which patient will the nurse assess first? 1. a 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. 2. A 3-year-old patient with von Willebrand disease who has a dose of desmopressin scheduled. 3. A 7-year-old patient with acute lymphocytic leukemia who has chemotherapy-induced thrombocytopenia. 4. A 16-year-old patient with sickle cell disease who reports acute right lower quadrant abdominal pain. The correct answer is 1. A 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. Because decreased responsiveness in a 1-year-old patient with a clotting disorder may indicate intracerebral bleeding, this patient should be assessed immediately. The other patients also require assessments or interventions, but are not at immediate risk for life-threatening or disabling complications.
Which patient is the most likely candidate for outpatient depot antipsychotic therapy? 1. Older man with psychosis secondary to dementia, who lives with his daughter. 2. Homeless veteran with schizophrenia, who occasionally sleeps in a nearby shelter. 3. Housewife with bipolar disorder, who has psychotic features during the manic phase. 4. Student with recently diagnosed schizophrenia, who lives at home with his parents. The correct answer is 2. Homeless veteran with schizophrenia, who occasionally sleeps in a nearby shelter. Rationale: depot antipsychotic therapy uses long-acting injectable medications. These medications are used for long-term maintenance for schizophrenia, for patients who may have some difficulties with adherence to taking medications. The homeless veteran has the least amount of social support and stability, which are factors in medication adherence. For the older adult patient with dementia and psychosis, identifying underlying factors and then behavioral therapies would be recommended first. Psychotic features in the manic phase of bipolar disorder would be treated as an acute episode. The student has the support of family, and the healthcare team will try to work with the patient and the family to build behaviors that support lifetime adherence to therapy. A patient with a mental health disorder is brought to the emergency department by the police. In determining hospitalization versus discharge back into the community, which consideration is given the highest priority? 1. Willingness of person to follow the treatment plan. 2. Potential for harm to self or others. 3. Availability of family or social support. 4. Ability of person to meet own basic physical needs. The correct answer is 2. Potential for harm to self or others. Rationale: potential for harm to self or others would be the priority, however, the other options are also important in planning for long-term outcomes. The charge nurse is reviewing the assignment sheet for an acute psychiatric unit. Which experienced team member should be reassigned? 1. Male nurse assigned to an older male patient with chronic depression and excessive rumination. 2. Young male psychiatric nursing assistant, assigned to a female adolescent with anorexia nervosa. 3. Female nurse assigned to a newly admitted female patient, who has command hallucinations and delusions of persecution. 4. Older female nurse with medical surgical experience, assigned to a male patient with Alzheimer's disease. The correct answer is 2. Young male psychiatric nursing assistant assigned to a female adolescent with anorexia nervosa. Rationale: adolescents in general are self-conscious in the presence of members of the opposite sex, and teenagers with anorexia are overly concerned with their appearance. Therefore, it would be better to assign this patient to a mature female staff member. An experienced nurse is able to set boundaries and to assist patients with chronic health problems. An experienced nurse should be assigned to new admissions and to patients with acute safety issues. A nurse with medical surgical experience would be well acquainted with care issues related to dementia. After reviewing medication prescriptions on an acute psychiatric unit, which prescription is the nurse most likely to question? 1. Fluoxetine for a middle-aged patient with depression. 2. Chlorpromazine for a young patient with schizophrenia. 3. Loxapine for an older adult patient with dementia and psychosis. 4. Lorazepam for a young patient with generalized anxiety disorder. The correct answer is 3. Loxapine for an older adult patient with dementia and psychosis. Rationale: conventional antipsychotics are usually not prescribed for older adult patients with psychosis secondary to dementia because of the increased incidence of death, usually from cardiac problems or infection. Fluoxetine for depression, chlorpromazine for schizophrenia, and lorazepam for generalized anxiety disorder are viable options. Which patient needs assessment first? 1. A patient who is having command hallucinations. 2. A patient who is demonstrating clang associations. 3. A patient who is verbalizing ideas of reference. 4. A patient who is using neologisms. The correct answer is 1. A patient who is having command hallucinations. Rationale: during command hallucinations, the patient may be getting a command to harm self or others. Content must be assessed. Ideas of reference occur when an ordinary thing or event has personal significance. Ideas of reference could escalate into aggression if delusions of persecution are present. Content must be assessed. Clang association is a meaningless rhyming of words, and neologisms are new words created by patients. These communication patterns create frustration for staff and patients, but there is no need for immediate intervention. The nurse is interviewing a patient with suicidal ideations and a history of major depression. Which comment is cause for greatest concern? 1. I have had problems with depression most of my adult life. 2. My father and my brother both committed suicide. 3. My wife is having health problems, and she relies on me. 4. I am afraid to kill myself, and I wish I had more courage. The correct answer is 2. My father and my brother both committed suicide. Rationale: the patient has a strong family history of completed suicide, which is an increased risk factor. The patient may believe that other family members have successfully used suicide to solve their problems. A long history of depression suggests that the problem is chronic. Assess for treatment history, risk factors, and coping strategies. Having a feeling of responsibility toward others and feeling fear are protective factors that can be used in the treatment plan. The nurse is working with a healthcare provider who recently started treating patients with depression. Which action by the HCP would prompt the nurse to intervene? 1. Tells the patient and family that it may take 4 to 8 weeks before the antidepressant medication begins to relieve symptoms. 2. Prescribes 3 months of antidepressants for a patient newly diagnosed with depression and gives a 3-month follow-up appointment. 3. Instructs the patient that the initial dose is low, but will gradually be increased to reach a maintenance dosage. 4. Tells the patient and the family to watch for and immediately report anxiety, agitation, irritability, or suicidal thoughts. The correct answer is 2. Prescribes 3 months of antidepressants for a patient newly diagnosed with depression and gives a 3-month follow-up appointment. Rationale: patients with depression are at high risk for suicide, and antidepressants can be used to commit suicide. For the patient who was recently diagnosed with depression and prescribed antidepressants, the nurse intervenes because a small number of doses should be prescribed and dispensed, and follow-up should be weekly to allow for close monitoring and assessment. The other options are correct information to share with patients and family members. A newly graduated nurse has just started working at the acute psychiatric unit. Which patient would be the best to assign to this nurse? 1. Patient who is frequently admitted for borderline personality disorder and suicidal gestures. 2. Patient admitted yesterday for disorganized schizophrenia and psychosis. 3. Patient newly admitted with possible differential diagnosis of depression, dementia, or delirium. 4. Patient newly diagnosed with major depression and rumination about loss and suicide. The correct answer is 4. Patient newly diagnosed with major depression and rumination about loss and suicide. Rationale: although the patient is ruminating about suicide, in the early phase of major depression, the patient has minimal energy to act. The danger of suicide will increase as the medication and therapy begin to help. A new nurse lacks experience with therapeutic boundary setting that is necessary for patients with borderline personality disorder. Psychotic patients can seem very threatening to new nurses, and it takes experience to interpret psychotic behavior. Depression, dementia, and delirium have some behavior and symptom overlap. This patient should be assigned to an experienced nurse until the delirium is treated or ruled out. The team must apply restraints to a combative patient to prevent harm to others or to self. Which action requires the charge nurse's intervention? 1. The psychiatric nursing assistant uses a quick-release knot to tie restraints. 2. The nurse secures the restraint to the side rail. 3. The nurse checks the pulses distal to the restraints. 4. The nurse explains to the patient why he is being restrained. The correct answer is 2. The nurse secures the restraint to the side rail. Rationale: the restraints must be tied to a stationary portion of the bed. Quick-release knots are for safety, in case the restraints need to be quickly removed. Distal pulses should be checked. The HCP or nurse is usually responsible for explaining the restraint procedure. However, restraining a combative patient is rarely a planned event, and the caregiver, who has the best relationship with the patient, may be the best spokesperson. A nurse complains to the charge nurse that she is always assigned to the same patient with chronic depression. What should the charge nurse do? 1. Look at the assignment sheet and see if there is any way to switch assignments with another nurse. 2. Tell her to care for the patient today, but that her request will be considered for future assignments. 3. Remind her that continuity of care and patient-centered care are the primary goals. 4. Explain that patients with chronic conditions are more likely to fall under the nurse's scope of practice. The correct answer is 2. Tell her to care for the patient today, but that her request will be considered for future assignments. Rationale: switching the assignments at shift change or mid-shift creates delays for everyone, so politely ask her to continue for the day. Nevertheless, her request is not unreasonable. Dealing with depressed patients can be very exhausting, so consider her request for future assignments. Although many patients benefit from having the same caregiver, a chronically depressed patient might benefit from stimulation by various caregivers. Explaining scope of practice and continuity of care is probably not necessary and may seem condescending.
The nurse is preparing to have a patient who has acute leukemia sign the permit for a bone marrow aspiration. The patient states that the oncologist has explained the procedure and the complications, and she has no further questions. What assessment is most important for the nurse to complete before the procedure is carried out? 1. Review the patient's do not resuscitate status. 2. Review the platelet count. 3. Review the leukocyte count. 4. Ask when the patient ate last. The correct answer is 2. Review the platelet count. The most important assessment to carry out before the procedure is to review the platelet count to ensure that the platelets are within normal limits. A complication of a bone marrow aspiration is bleeding, and platelets are necessary for normal clotting to take place. The nurse should also review the prothrombin time, partial thromboplastin time, and international normalized ratio for the same reason. A patient's DNR status should be reviewed in case of an emergency on all ill patients as a general rule. The leukocyte count in leukemia is expected to be altered and is not important when considering the bleeding complication. Usually, it is not necessary for a patient to be NPO before the procedure. A patient with sickle cell disease is admitted with splenic sequestration. The blood pressure is 86/40 and heart rate is 124 beats per minute. Which of these actions will the nurse take first? 1. Complete a head-to-toe assessment. 2. Draw blood for type and cross-match. 3. Infuse normal saline at 250 ml per hour. 4. Ask the patient about vaccination history. The correct answer is 3. Infuse normal saline at 250 ml per hour. Because the patient is severely hypotensive, correction of hypovolemia caused by the splenic sequestration is the most urgent action. Nevertheless, the other actions are appropriate because a complete assessment will be needed to plan care, a transfusion is likely to be needed, and vaccination history is pertinent for patients with sickle cell disease. Infusion of saline, however, is the priority need. Which of these patients who have just arrived at the emergency department should the nurse assess first? 1. Patient who reports several dark, tarry stools and a history of peptic ulcer disease. 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. 3. Patient who has pernicious anemia and reports paresthesia of the hands and feet. 4. Patient with thalassemia major who needs a scheduled blood transfusion. The correct answer is 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. Thigh swelling after an injury in a patient with hemophilia likely indicates acute bleeding, which can compromise blood flow and nerve function in the leg, and should be treated immediately with the administration of factor replacement. The other patients also need assessment, treatment, or both, but the data do not indicate any immediate threat to life or function. The nurse is reviewing the complete blood count for a patient who has been admitted for knee arthroscopy. Which value is most important to report to the healthcare provider before surgery? 1. Hematocrit of 33%. 2. Hemoglobin level of 10.9 grams per deciliter. 3. Platelet count of 426,000 cubic milliliters. 4. White blood cell count of 16,000 cubic milliliters. The correct answer is 4. White blood cell count of 16,000 cubic milliliters. Centers for Disease Control and Prevention guidelines for the prevention of surgical site infections indicate that surgery should be postponed when there is evidence of a pre-existing infection, such as an elevation in white blood cell count. The other values are slightly abnormal, but would not be likely to cause post-operative problems for knee arthroscopy. A 32-year-old patient with sickle cell anemia is admitted to the hospital during a sickle cell crisis. Blood pressure is 104/62, oxygen saturation is 85%, and the patient reports pain at a level 8. Which action prescribed by the healthcare provider will the nurse implement first? 1. Administer morphine sulfate 4 to 8 milligrams IV. 2. Give oxygen at 4 liters per minute via nasal cannula. 3. Start an infusion of normal saline at 200 ml per hour. 4. Apply warm packs to painful joints. The correct answer is 2. Give oxygen at 4 liters per minute via nasal cannula. National guidelines for sickle cell crisis indicate that oxygen should be administered if the oxygen saturation is less than 95%. Hypoxia and deoxygenation of the blood cells are the most common cause of sickling, so administration of oxygen is the priority intervention here. Pain control and hydration are also important interventions for this patient and should be accomplished rapidly. The charge nurse is making the daily assignments on the medical surgical unit. Which patient is best assigned to a float nurse who has come from the post-anesthesia care unit? 1. A 30-year-old patient with thalassemia major who has an order for subcutaneous infusion of deferoxamine. 2. A 43-year-old patient with multiple myeloma who requires discharge teaching. 3. A 52-year-old patient with chronic gastrointestinal bleeding who has returned to the unit after a colonoscopy. 4. A 65-year-old patient with pernicious anemia who has just been admitted to the unit. The correct answer is 3. A 52-year-old patient with chronic gastrointestinal bleeding who has returned to the unit after a colonoscopy. A nurse who works in the post-anesthesia care unit will be familiar with the monitoring needed for a patient who has just returned from a procedure such as a colonoscopy, which requires moderate sedation or monitored anesthesia care. Care of the other patients requires staff with more experience with various types of hematologic disorders and would be better to assign to nursing personnel who regularly work on the medical surgical unit. A 67-year-old patient who is receiving chemotherapy for lung cancer is admitted to the hospital with thrombocytopenia. Which statement made by the patient when the nurse is obtaining the admission history is of most concern? 1. I've noticed that I bruise more easily since the chemotherapy started. 2. My bowel movements are soft and dark brown. 3. I take ibuprofen every day because of my history of osteoarthritis. 4. My appetite has decreased since the chemotherapy started. The correct answer is 3. I take ibuprofen every day because of my history of osteoarthritis. Because nonsteroidal anti-inflammatory drugs will decrease platelet aggregation, patients with thrombocytopenia should not use ibuprofen routinely. Patient teaching about this should be included in the care plan. Bruising is consistent with the patient's admission problem of thrombocytopenia. Soft, dark brown stools indicate that there is no frank or occult blood in the bowel movements. Although the patient's decreased appetite requires further assessment by the nurse, this is a common complication of chemotherapy. The home health nurse is obtaining a history for a patient who has deep vein thrombosis and is taking warfarin 2 mg per day. Which statement by the patient is the best indicator that additional teaching about warfarin may be needed? 1. I have started to eat more healthy foods like green salads and fruit. 2. The doctor said that it is important to avoid becoming constipated. 3. Warfarin makes me feel a little nauseated unless I take it with food. 4. I will need to have some blood testing done once or twice a week. The correct answer is 1. I have started to eat more healthy foods like green salads and fruit. Patients taking warfarin are advised to avoid making sudden dietary changes because changing the oral intake of foods high in vitamin K will have an impact on the effectiveness of the medication. The other statements suggest that further teaching may be indicated, but more assessment for teaching needs is required first. A patient with iron deficiency anemia who is taking oral iron supplements is evaluated by the nurse in the outpatient clinic. Which finding by the nurse is of most concern? 1. The patient reports that stools are black. 2. The patient complains of occasional constipation. 3. The patient takes a multivitamin tablet every day. 4. The patient takes an antacid with the iron to avoid nausea. The correct answer is 4. The patient takes an antacid with the iron to avoid nausea. Concurrent use of antacids with iron supplements will decrease absorption of the iron and decrease the efficacy in resolving the patient's anemia. Black stools are expected when taking oral iron. The patient's occasional constipation may indicate a need for information about prevention of constipation while taking iron. Use of a multivitamin tablet is safe when taking iron supplements. A 22-year-old patient with stage 1 Hodgkin disease is admitted to the oncology unit for radiation therapy. During the initial assessment, the patient tells the nurse, "Sometimes I'm afraid of dying." Which response is most appropriate at this time? 1. Many individuals with this diagnosis have some fears. 2. Perhaps you should ask the doctor about medication. 3. Tell me a little bit more about your fear of dying. 4. Most people with stage 1 Hodgkin disease survive. The correct answer is 3. Tell me a little bit more about your fear of dying. More assessment about what the patient means is needed before any interventions can be planned or implemented. All of the other statements indicate an assumption that the patient is afraid of dying of Hodgkin disease, which may not be the case. According to evidence-based guidelines from the American Optometric Association, which modifiable risk factor is the most important to emphasize during patient teaching to reduce the risk for age-related macular degeneration? 1. Initiate smoking cessation. 2. Take vitamin D and E supplements. 3. Eat dark green, leafy vegetables. 4. Wear protective eyewear as needed. The correct answer is 1. Initiate smoking cessation. According to the American Optometric Association, smoking cessation is the most important modifiable factor for decreasing risk for age-related macular degeneration. Consumption of dark green vegetables and use of vitamin supplements are recommended, but the evidence is less compelling. Use of protective eyewear is recommended to prevent eye injuries during active sports or hazardous occupations, but this preventative measure is not related to age-related macular degeneration. A patient calls the clinic and reports redness of the sclera, itching of the eyes, and increased lacrimation for several hours. What should the nurse direct the caller to do first? 1. Please call your healthcare provider. 2. Apply a cool compress to your eyes. 3. If you are wearing contact lenses, remove them. 4. Take an over-the-counter antihistamine. The correct answer is 3. If you are wearing contact lenses, remove them. If the patient is wearing contact lenses, the lenses may be causing the symptoms, and removing them will prevent further eye irritation or damage. Policies on giving telephone advice vary among institutions, and knowledge of the facility policy is essential. The other options may be appropriate, but additional information is needed before suggesting anything else. Which findings should be immediately reported to the healthcare provider? 1. A change in color vision. 2. Crusty yellow drainage on the eyelashes. 3. Increased lacrimation. 4. A curtain-like shadow across the visual field. The correct answer is 4. A curtain-like shadow across the visual field. A curtain-like shadow is a symptom of retinal detachment, which is an emergency situation. A change in color vision is a symptom of a cataract. Crusty drainage is associated with conjunctivitis. Increased lacrimation is associated with many eye irritants, such as allergies, contact lenses, or foreign bodies. After cataract surgery, which symptom needs to be immediately reported to the healthcare provider? 1. A scratchy sensation in the operative eye. 2. Loss of depth perception with the patch in place. 3. Poor vision 6 to 8 hours after patch removal. 4. Pain not relieved by prescribed medication. The correct answer is 4. Pain not relieved by prescribed medication. Pain may signal hemorrhage, infection, or increased ocular pressure. A scratchy sensation and loss of depth perception with the patch in place are common. Adequate vision may not return for 24 hours. According to evidence-based guidelines from the American Optometric Association, which patient needs to have an annual eye examination? 1. 18-year-old who is asymptomatic and has low risk. 2. 40-year-old who is asymptomatic and has low risk. 3. 55-year-old who is asymptomatic and has low risk. 4. 67-year-old who is asymptomatic and has low risk. The correct answer is 4. 67-year-old who is asymptomatic and has low risk. People 65 years or older are advised to have eye examinations annually or even more frequently, even if they have low risk. People who are 18 to 64 years old with low risk are advised to have eye examinations at least every 2 years. Examples of risk factors include family history for eye disease, systemic health conditions that affect the eyes, such as diabetes, racial or ethnic backgrounds with increased risk, such as African Americans, occupations that are eye hazardous, prescription or non-prescription drugs with ocular side effects, contact lenses, previous eye surgery or eye injury, and having functional vision in only one eye. The nurse is on a camping trip. A man who is chopping wood gets struck in the eye with a piece of debris. On examination, a wood splinter is protruding from his eyeball. What should the nurse do first? 1. Have the man lie in the back seat of the car and drive him to the emergency department. 2. Gently remove the piece of wood and place a sterile dressing over the eye. 3. Carefully rest a plastic cup on the orbital rim and tape it in place. 4. Flush the eye with copious amounts of clean tepid water, then check visual acuity. The correct answer is 3. Carefully rest a plastic cup on the orbital rim and tape it in place. Penetrating objects should not be removed or disturbed by anyone except an eye specialist because the object may be creating a tamponade effect. Removing or disrupting the object could result in additional damage to the eye. The man needs to have emergency care, and 911 should be called. But if there are no emergency services available, the man should sit in the back seat of the car with a seatbelt in place for transport to the nearest facility. If an eye has been cut or punctured, the bottom of a paper cup taped to the bones surrounding the eye can serve as a shield until you get medical attention. After a penetrating eye injury has been assessed and treated by an ophthalmologist, there is a possibility that based on the ophthalmologist recommendations, foreign body removal, flushing, and dressing application could be accomplished in the emergency department. However, penetrating objects frequently require surgical removal. Antibiotics and a tetanus immunization are administered before the patient is transferred to the operating room. A client sustains a chemical eye injury from a splash of battery acid. The nurse should prepare the client for which immediate measure? 1. Checking visual acuity. 2. Covering the eye with a pressure patch. 3. Swabbing the eye with antibiotic ointment. 4. Irrigating the eye with sterile normal saline. The correct answer is 4. Irrigating the eye with sterile normal saline. Emergency care after a chemical burn to the eye includes irrigating the eye immediately with sterile normal saline or ocular irrigating solution. The irrigation should be maintained for at least 10 minutes. After this emergency treatment, visual acuity is assessed. Options 2 and 3 are not immediate measures. A nursing student is assisting an older patient who has decreased vision related to macular degeneration. The patient is alert, conversant, and cognitively intact. When would the supervising nurse intervene? 1. Student puts the call bell and personal items within reach and locates each item by guiding the patient's hand. 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. 3. Student talks to the patient about family and asks, "So, when was the last time that you saw your uncle?" 4. Student assists during mealtime by opening packages and describing location of foods by using clock coordinates. The correct answer is 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. For patients who retain some vision, the room should be well lit. Even at night, there should be a nightlight. Other options are correct actions. Words such as see, look, or view are parts of normal speech, and it's acceptable and natural to use these terms. Which patients would be best to assign to the most experienced nurse in an ambulatory care center that specializes in vision problems and eye surgery? Select all that apply. 1. Patient who requires post-operative instructions after cataract surgery. 2. Patient who needs an iPad and a metal shield applied. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 4. Patient who needs teaching about self-administration of eye drop. 5. Patient who requires an assessment for recent and sudden loss of sight. 6. Patient who requires preoperative teaching for laser trabeculoplasty. The correct answers are 1. Patient who requires post-operative instructions after cataract surgery. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 5. Patient who requires an assessment for recent and sudden loss of sight. And 6. Patient who requires preoperative teaching for laser trabeculoplasty. Providing post-operative and preoperative instructions, making home health referrals, and assessing for needs related to loss of vision should be done by an experienced nurse who can give specific details and specialized information about follow-up eye care and adjustment to loss. The principles of applying an iPad and shield and teaching the administration of eye drops are basic procedures that should be familiar to all nurses. The nurse is supervising a new nurse who has just finished assessing a patient for redness and discomfort to the right eye. The new nurse documents Visual Acuity NA. Which action would the supervising nurse take? 1. Do nothing. The documentation is minimal but acceptable. 2. Ask her to explain the rationale for the documentation. 3. Reassess the patient's eye and vision to validate findings. 4. Suggest contacting the clinical educator for documentation tips. The correct answer is 2. Ask her to explain the rationale for the documentation. Asking the nurse to explain the documentation is a way of assessing her knowledge of documentation, her understanding of how the patient's report guides the focused assessment, and her understanding of the use of abbreviations. The nurse may have a good reason for charting NA, but a reader could misunderstand. For example, Visual acuity NA could be interpreted as the nurse making a clinical judgment that assessing vision was not applicable for this patient. The documentation is not acceptable because the patient's report indicates that vision should be tested if at all possible. Redoing the assessment does not help the nurse to correct mistakes. Contacting the educator for assistance is an option that is based on assessment of her rationale. An older patient had ranibizumab injected into his eye for treatment of wet, age-related macular degeneration several days ago. He is now experiencing redness, light sensitivity, and pain. Which advice would the nurse give to the patient? 1. These are common side effects that should pass after a few more days. 2. Contact the healthcare provider immediately for possible eye infection. 3. Rest eyes as much as possible and wear sunglasses if lights are too bright. 4. Inform the HCP before the next treatment so that the dosage can be adjusted. The correct answer is 2. Contact the healthcare provider immediately for possible eye infection. Ranibizumab is an angiogenesis inhibitor that is directly injected into the vitreous humor of the eye. The purpose of the medication injection is to inhibit the growth of new blood vessels in patients who have neovascular age-related macular degeneration. The biggest concern about adverse effects of the treatment is endophthalmitis. This can be caused by bacteria, virus, or fungus. Redness, light sensitivity, or pain are signs of possible endophthalmitis that should be immediately reported to the provider.
The clinic nurse is evaluating a patient who had coronary artery stenting through the right femoral artery a week previously and is taking metoprolol, clopidogrel, and aspirin. Which information reported by the patient is most important to report to the healthcare provider? 1. Patient is experiencing shortness of breath and fatigue. 2. Bruising is present at the right groin. 3. Home blood pressure today was 104/52. 4. Home radial pulse rate has been 55 to 60 beats per minute. The correct answer is 1. Patient is experiencing shortness of breath and fatigue. Rationale: shortness of breath and fatigue may indicate anemia from gastrointestinal bleeding, which is a possible adverse effect of both aspirin and clopidogrel. The patient will need to continue on the medications, but may need treatment with proton pump inhibitors or histamine 2 blockers to decrease risk for gastrointestinal bleeding. The other findings will also be reported to the healthcare provider, but will not require a change in the therapeutic plan for the patient. At 9 p.m., the nurse admits a 63-year-old patient with a diagnosis of acute myocardial infarction. Which finding is most important to communicate to the healthcare provider, who is considering the use of fibrinolytic therapy with tissue plasminogen activator for the patient? 1. The patient was treated with alteplase about 8 months ago. 2. The patient takes famotidine for gastroesophageal reflux disease. 3. The patient has ST segment elevations on the electrocardiogram. 4. The patient reports having continuous chest pain since 8 a.m. The correct answer is 4. The patient reports having continuous chest pain since 8 a.m. Rationale: because continuous chest pain lasting for more than 12 hours indicates that reversible myocardial injury has progressed to irreversible myocardial necrosis. Fibrinolytic drugs are usually not recommended for patients with chest pain that has lasted for more than 12 hours. The other information is also important to communicate, but would not impact the decision about alteplase use. Which patient should the charge nurse assign to a newly graduated nurse who is orientating to the neurologic care unit? 1. A 28-year-old newly admitted patient with a spinal cord injury. 2. A 67-year-old patient who had a stroke 3 days ago and has left-sided weakness. 3. An 85-year-old patient with dementia who is to be transferred to long-term care today. 4. A 54-year-old patient with Parkinson's disease who needs assistance with bathing. The correct answer is 2. A 67-year-old patient who had a stroke 3 days ago and has left-sided weakness. Rationale: the newly graduated nurse who is on orientation to the unit should be assigned to care for patients with stable, non-complex conditions, such as the patient with stroke. The task of helping the patient with Parkinson's disease to bathe is best delegated to the assistive personnel. The patient being transferred to the nursing home and the newly admitted patient with a spinal cord injury should be assigned to nurses with experience in neurological nursing care.
Which statement by the student nurse to the 21-year-old pregnant woman who smokes would require the supervising nurse to intervene? 1. Pregnancy is an excellent time to quit smoking. 2. Vaping instead of smoking during pregnancy is less risky. 3. You should not allow anyone to smoke around you during pregnancy. 4. You should not allow anyone to smoke around the baby when she is born. The correct answer is 2. Vaping instead of smoking during pregnancy is less risky. The nurse would need to intervene to correct erroneous information being given to the patient. Vaping is not safer than smoking in pregnancy. Babies born to mothers who vape have levels of nicotine exposure, low birth weight, and shortened gestational age equal to infants born to mothers who smoke. Clear advice about pregnancy being an excellent time to quit and then providing resources to do so is appropriate education. Advising the mother to avoid secondhand smoke during the pregnancy and after delivery is appropriate advice. Several patients have just come into the obstetric triage unit. Which patient should the nurse assess first? 1. A 17-year-old Gravida 1, para-0 woman at 40 weeks gestation with contractions every 6 minutes who is crying loudly and is surrounded by anxious family members. 2. A 22-year-old G3P2 woman at 38 weeks gestation with contractions every 3 minutes who is requesting to go to the bathroom to have a bowel movement. 3. A 32-year-old G4P3 woman at 27 weeks gestation who noted vaginal bleeding today after intercourse. 4. A 27-year-old G2P1 woman at 37 weeks gestation who experienced spontaneous rupture of membranes 30 minutes ago but feels no contractions. The correct answer is 2. A 22-year-old G3P2 woman at 38 weeks gestation with contractions every 3 minutes who is requesting to go to the bathroom to have a bowel movement. A multiparous patient in active labor with an urge to have a bowel movement will probably give birth imminently. She needs to be the first assessed. The healthcare provider must be notified immediately, and the patient must be moved to a safe location for the birth. She should not be allowed to go to the bathroom at this time. The other patients all have needs requiring prompt assessment, but the imminent birth takes priority. Vaginal bleeding after intercourse could be caused by cervical irritation or a vaginal infection, or could have a more serious cause such as placenta previa. Which action would best demonstrate evidence-based nursing practice in the care of a patient who is 1 day postpartum and reporting nipple soreness while breastfeeding? 1. Inform the mother that a certain amount of soreness is normal. 2. Assess the mother-baby couplet for nursing position and latch and correct as indicated. 3. Advise the use of a breast pump until nipple soreness resolve. 4. Advise alternating breastfeeding and pumping to avoid excess sucking at the nipple. The correct answer is 2. Assess the mother-baby couplet for nursing position and latch and correct as indicated. Improper latch and position are the most common causes of nipple soreness and can be corrected with assessment and assistance to the mother. This practice supports the perinatal core measure of increasing the percentage of newborns who are fed breast milk only. Advising the mother that soreness can be normal does not provide any assessment or assistance to the mother with her problem. Using a pump may be appropriate at some times during lactation, but the first priority is to assess and correct the issue that is causing the soreness. The nurse identified late fetal heart decelerations and decreased variability in the fetal heart rate of a woman in active labor and notified the healthcare provider on call, who advised the nurse that the pattern is acceptable. What would be the priority action at this time? 1. Advise the patient that a different HCP will be called because the first HCP's response was not adequate. 2. Discuss the concerns with another labor and delivery nurse. 3. Document the conversation with the HCP accurately, including the HCP's interpretation and recommendation, and continue close observation of the fetal heart rate. 4. Go up the chain of command and communicate the assessment of the fetal heart rate findings clearly to the next appropriate person per unit protocol. The correct answer is 4. Go up the chain of command and communicate the assessment of the fetal heart rate findings clearly to the next appropriate person per unit protocol. The nurse must follow through on the findings of a non-reassuring fetal heart rate. When patient safety is concerned, the nurse is obligated to pursue an appropriate response. Documenting the conversation with the HCP and discussing it with a colleague are appropriate, but something must be done to address the immediate safety concern and possible need for intervention at this time. The nurse must persist until the safety concern has been addressed appropriately. A 26-year-old Gravida 1, Para 1 patient who underwent a cesarean section 24 hours ago tells the nurse that she is having some trouble breastfeeding. Which tasks could be appropriately delegated to the assistive personnel on the postpartum floor? Select all that apply. 1. Providing the mother with an ordered abdominal binder. 2. Assisting the mother with breastfeeding. 3. Taking the mother's vital signs. 4. Checking the amount of lochia present. 5. Assisting the mother with ambulation. 6. Checking the incision site. The correct answers are 1. Providing the mother with an ordered abdominal binder. 3. Taking the mother's vital signs. And 5. Assisting the mother with ambulation. The AP could provide an abdominal binder, measure the vital signs of the patient, and assist her to ambulate. The nurse would be responsible for evaluating the normality of the vital sign values. The AP should be given parameter limits for vital signs and told to report values outside these limits to the nurse. Assisting in breastfeeding for a first-time mother is a very important nursing function because the nurse needs to give consistent, evidence-based advice to enhance success at breastfeeding. A common complaint of postpartum patients is inconsistent help with and advice on breastfeeding. The nurse should also be the one to check the amount of lochia and the surgical incision site because the evaluation requires nursing judgment. The use of the professionally educated nurse to provide evidence-based and consistent information and assistance with breastfeeding supports the perinatal core measure of increasing the percentage of newborns who are fed breast milk only. While assessing a 29-year-old Gravida 2, Para 2 patient who had a normal spontaneous vaginal delivery 30 minutes ago, the nurse notes a large amount of red vaginal bleeding. Which nursing action would be the priority? 1. Check vital signs. 2. Notify the healthcare provider. 3. Firmly massage the uterine fundus. 4. Put the baby to breast. The correct answer is 3. Firmly massage the uterine fundus. Fundal massage would be the priority nursing action because it helps the uterus to contract firmly and thus reduces bleeding. The first two answer choices are appropriate nursing actions, but do nothing to stop the immediate bleeding. Putting the baby to the breast does release oxytocin, which causes uterine contraction, but it will be slower to do so than fundal massage. A 22-year-old Gravida 1, Para 0 woman is being given an epidural anesthetic for pain control during labor and birth. Which are appropriate nursing actions when epidural anesthesia is used during labor? Select all that apply. 1. Request the anesthesiologist to discontinue the epidural anesthetic when the patient's cervix is completely dilated to allow the patient to sense the urge to push. 2. Insert an indwelling catheter because the woman is likely to be unable to void. 3. Encourage ambulation to encourage descent of the fetal head. 4. Encourage the patient to turn from side to side during the course of labor. 5. Teach the patient that pain relief can be expected to last 1 to 2 hours. 6. Explain to the patient that she will feel very drowsy after the epidural is given. The correct answers are 2. Insert an indwelling catheter because the woman is likely to be unable to void, and 4. Encourage the patient to turn from side to side during the course of labor. Insertion of an indwelling catheter is indicated because the woman will usually be unable to void because of the effect of the anesthetic in the bladder area. Positioning the patient on her side enhances blood flow and helps to prevent hypotension. Changing maternal position encourages progress in labor. With epidural anesthesia, ambulation is not usually an option due to decreased sensation in the legs. It is not recommended to routinely discontinue an epidural anesthetic at complete dilation. A continuous epidural infusion provides pain relief throughout labor and birth. Drowsiness is not a common side effect with epidural anesthesia. Drowsiness would be more likely with the use of IV narcotics for pain relief in labor. Use of evidence-based practices with a laboring woman supports the perinatal core measure of reducing the percentage of women who are delivered by cesarean section. A 30-year-old Gravida 6, para 5 woman at 12 weeks gestation has just begun prenatal care, and her initial laboratory work reveals that she has tested positive for human immunodeficiency virus infection. Which information would be priority evidence-based nursing education for this patient today? 1. Medication for HIV infection is safe and can greatly reduce transmission of HIV to the infant. 2. Breastfeeding is still recommended because of the great benefits to the infant. 3. Pregnancy is known to accelerate the course of HIV disease in the mother. 4. Cesarean section is not recommended because of the increased risk of HIV transmission with the bleeding at surgery. The correct answer is 1. Medication for HIV infection is safe and can greatly reduce transmission of HIV to the infant. Administration of antiviral medications to the pregnant woman and the newborn cesarean birth if HIV RNA levels are greater than 1,000 copies per milliliter, and avoidance of breastfeeding have reduced the incidence of perinatal transmission of HIV from approximately 26% to between 1% to 2%. Pregnancy is not known to accelerate HIV disease in the mother. The most important nursing action is to engage the mother in prenatal care and educate her as to the great benefits of medication for HIV during pregnancy.
Health history. Hypertension for 10 years. Takes hydrochlorothiazide 25 mg daily. Blood pressure ranges from 110/60 to 132/72. Family history. Patient's mother and 2 siblings have had myocardial infarctions. Social history. 20-pack-year history of cigarette use. Walks 2 to 3 miles daily. While reviewing a hospitalized patient's medical record, the nurse obtains this information about cardiovascular risk factors. Which interventions will be important to include in the discharge plan for this patient? Select all that apply. 1. Referral to community programs that assist in smoking cessation. 2. Teaching about the impact of family history on cardiovascular risk. 3. Education about the need for a change in antihypertensive therapy. 4. Assistance in reducing emotional stress. 5. Discussion of the risks associated with having a sedentary lifestyle. 6. Teaching about the signs of hypokalemia and foods to supplement potassium loss. The correct answers are 1. Referral to community programs that assist in smoking cessation, 2. Teaching about the impact of family history on cardiovascular risk, and 6. Teaching about the signs of hypokalemia and foods to supplement potassium loss. Rationale: the patient's major modifiable risk factor is ongoing smoking. The family history is significant, and the patient should be aware that this increases cardiovascular risk. The blood pressure is well controlled on the current medication, and no change is needed. There is no indication that stress is a risk factor for this patient, and the patient's activity level meets the American Heart Association recommendation for at least 150 minutes of moderate activity weekly. Hydrochlorothiazide can deplete potassium. Muscle weakness and cramping are signs of hypokalemia. Bananas, yogurt, spinach, and avocados are some foods that are high in potassium.
A 7-month-old infant arrives at the health center for a scheduled well child visit. When the nurse approaches the infant to obtain vital signs, the infant cries vigorously and clings fearfully to the mother. Which of the following phenomena provides the best explanation for the infant's behavior? 1. Separation anxiety. 2. Dissociation disorder. 3. Stranger anxiety. 4. Autism spectrum. The correct answer is 3. Stranger anxiety. This infant is displaying stranger anxiety. The child becomes anxious when exposed to unfamiliar people. Separation anxiety occurs when the child is separated from the primary caregiver. Anxiety and crying are also common behaviors. Stranger anxiety and separation anxiety are concurrent and generally begin at 7 to 8 months of age. An unimmunized 7-year-old child who attends a local elementary school contracts rubeola. The child has 2 siblings, ages 9 and 11 years, who also attend the elementary school. Which action by the school nurse is a priority? 1. Exclude the child and siblings from attending school for 21 days. 2. Notify all parents of children attending the school of the exposure. 3. Recommend that the siblings receive the measles vaccine. 4. Recommend that the siblings receive measles immunoglobulin. The correct answer is 1. Exclude the child and siblings from attending school for 21 days. Rubeola is a highly contagious infectious disease with severe consequences that include death. The Centers for Disease Control and Prevention reports that 9 of 10 susceptible people with close contact to a person with measles will contract the disease. The incubation period is 7 to 21 days. Excluding the infected and exposed children during this period of time is a priority to prevent exposure of healthy children enrolled in the elementary school. Although it is important to notify the parents of the other children in the school of the exposure, limiting exposure of other children is the priority. Mumps, measles, and rubella vaccine administered within 72 hours of initial measles exposure and immunoglobulin administered within 6 days of exposure may provide some protection or modify the clinical course of the disease in unimmunized children. However, the priority is to prevent an epidemic by limiting exposure. An adolescent with cystic fibrosis is admitted to the pediatric unit with increased shortness of breath and pneumonia. Which nursing activity is most important to include in the patient's care? 1. Allowing the adolescent to decide if aerosolized medications are needed. 2. Scheduling postural drainage and a chest physiotherapy every 4 hours. 3. Placing the adolescent in a room with another adolescent with CF. 4. Encouraging oral fluid intake of 2,400 milliliters per day. The correct answer is 2. Scheduling postural drainage and a chest physiotherapy every 4 hours. National guidelines indicate that airway clearance techniques are critical for patients with CF. Thus, postural drainage and chest physiotherapy are a priority. National guidelines also indicate that children and adolescents with CF who are hospitalized with respiratory illnesses should be placed on contact precautions. Furthermore, people with CF should be separated from others with CF to reduce droplet transmission of CF pathogens. There is no evidence that increased fluid intake adequately thins respiratory secretions, and chest physiotherapy is the priority. The nurse obtains this information when assessing a 3-year-old patient with uncorrected tetralogy of Fallot who is crying. Which finding requires immediate action? 1. The apical pulse rate is 118 beats per minute. 2. A loud systolic murmur is heard in the pulmonic area. 3. There is marked clubbing of the child's nail beds. 4. The lips and oral mucosa are dusky in color. The correct answer is 4. The lips and oral mucosa are dusky in color. Circumoral cyanosis indicates a drop in the partial pressure of oxygen that may precipitate seizures and loss of consciousness. The nurse should rapidly place the child in a knee-chest position, administer oxygen, and take steps to calm the child. The other assessment data are expected in a child with congenital heart defects, such as tetralogy of Fallot. After receiving the change of shift report, which patient should the nurse assess first? 1. An 18-month-old patient with coarctation of the aorta who has decreased pedal pulses. 2. A 3-year-old patient with rheumatic fever who reports severe knee pain. 3. A 5-year-old patient with endocarditis who has crackles audible throughout both lungs. 4. An 8-year-old patient with Kawasaki disease who has a temperature of 102.2 degrees Fahrenheit. The correct answer is 3. A 5-year-old patient with endocarditis who has crackles audible throughout both lungs. Crackles throughout both lungs indicate that the child has severe left ventricular failure as a complication of endocarditis. Hypoxemia is likely, so the child needs rapid assessment of oxygen saturation, initiation of supplemental oxygen delivery, and administration of medications such as diuretics. The other children should also be assessed as quickly as possible, but they are not experiencing life-threatening complications of their medical diagnoses. The staff nurse is working with a student nurse to provide care for a 10-year-old patient with severe abdominal, hip, and knee pain caused by a sickle cell crisis. Which action taken by the student requires the staff nurse to intervene immediately? 1. Administering oral pain medication as needed. 2. Positioning cold packs on the child's knees. 3. Encouraging increased fluid intake. 4. Monitoring vital signs every 2 hours. The correct answer is 2. Positioning cold packs on the child's knees. Sickle cell crisis may include vaso-occlusive crisis, splenic sequestration, and aplastic crisis. The symptoms experienced by this child are indicative of both vaso-occlusive crisis and splenic sequestration. Placing cold packs on the knees of a child with vaso-occlusive crisis results in vasoconstriction, placing the child at risk for thrombosis formation. Encouraging increased fluid intake is advised to prevent thrombosis formation. Monitoring vital signs is a method to assess for life-threatening complications associated with both vaso-occlusive crisis and splenic sequestration. Vaso-occlusive crisis is associated with severe pain, and pain medication is recommended.
What is the nurse's most important role in helping patients who have schizophrenia to benefit from a comprehensive approach that includes medication and multidisciplinary non-drug therapies? 1. Help identify patients who would benefit from conventional psychotherapy. 2. Refer patients to a psychiatric nurse specialist for education about the disease. 3. Suggest that patients talk to vocational specialists for additional training. 4. Establish a therapeutic relationship with patients and encourage participation. The correct answer is 4. Establish a therapeutic relationship with patients and encourage participation. Rationale: the nurse and the psychiatric nursing assistant spend more time with the patients than any of the other members of the healthcare team, thus establishing a good therapeutic relationship is essential to building trust, increasing social skills, encouraging medication adherence, and suggesting participation in educational, socialization, and vocational opportunities. Conventional psychotherapy is generally not used with patients with schizophrenia. A patient who was recently diagnosed with conversion disorder is experiencing a sudden loss of vision after witnessing a violent fight between her husband and adult-age son. What is the priority therapeutic approach to use with this patient? 1. Reassure her that her blindness is temporary and will resolve with time. 2. Gently point out that she can see well enough to function independently. 3. Encourage expression of feelings and link emotional trauma to the blindness. 4. Teach ways to cope with blindness, such as methodically arranging personal items. The correct answer is 4. Teach ways to cope with blindness, such as methodically arranging personal items. Rationale: patients with conversion disorders are experiencing symptoms, even though there is no identifiable organic cause. Therefore, the patient should be assisted in learning ways to cope and live with the disability. The patient may physically be able to see, but pointing this out is not helpful. Encouraging the expression of feelings is okay, but it is premature to expect the patient to link the fight to her blindness. It is likely that the sudden onset of blindness will resolve, but the priority therapeutic approach is teaching her ways to cope in the meantime. There is a patient on the rehabilitation unit who has been there for several months. He is hostile, rude, and belligerent, and no one likes to interact with him. How should the charge nurse handle the assignment? 1. Rotate the assignment schedule, so that no one has to care for him more than once or twice a week. 2. Pair a float nurse and a nursing student, and assign this team to care for the patient. They will have a fresh perspective. 3. identify several experienced nurses as primary caregivers, and develop a plan that includes psychosocial interventions. 4. Assign self as primary caregiver and role model, how patients should be treated. The correct answer is 3. Identify several experienced nurses as primary caregivers, and develop a plan that includes psychosocial interventions. Rationale: this patient has trouble with interpersonal interactions, so consistent caregivers who use psychosocial interventions have the best chance of developing a functional nurse-patient relationship. Rotating the assignment sheet to give the staff a break, and using float staff are frequent strategies that are used, but these are not necessarily the best for the patient. Taking the patient may seem like the easiest solution for the charge nurse, but in the long run, strengthening and supporting the staff are better strategies. A patient diagnosed with paranoid schizophrenia says, "Dr. Smith has killed several other patients, and now he is trying to kill me." What is the best response? 1. I have worked here a long time, no one has died, you are safe here. 2. What has Dr. Smith done to make you think he would like to kill you? 3. All of the staff, including Dr. Smith, are here to ensure your safety. 4. Whenever you are concerned or nervous, talk to me or any of the nurses. The correct answer is 4. Whenever you are concerned or nervous, talk to me or any of the nurses. Rationale: the nurse can acknowledge the patient's fears without agreeing or disagreeing with his accusation. Directing him to talk to the nursing staff provides a source of emotional support and an action that he can use to decrease his anxiety. Telling the patient that no one has died and that the staff will ensure safety is presenting reality. However, he has a delusional belief and arguments should be avoided. Asking him to explain his rationale for his beliefs encourages him to elaborate on his delusion. The patient has a panic disorder and is having difficulty controlling his anxiety. Which symptoms are cause for greatest concern? 1. His heart rate is increased, and he reports chest tightness. 2. He demonstrates tachypnea and carpopedal spasms. 3. He is pacing and pounding his fists together. 4. He is muttering to himself and is easily startled. The correct answer is 3. He is pacing and pounding his fists together. Rationale: all of these symptoms signal an increase of anxiety. However, physically aggressive behavior signals a danger to others and to self. Verbal intervention is still possible, but the pacing and fist pounding are a step above the other symptoms. Tachycardia and chest tightness are assessed but should abate as the patient becomes less anxious. Carpopedal spasms occur during hyperventilation. Assisting the patient to breathe in a paper bag will help. Muttering to self can be interrupted by using a normal conversational tone and topic. A patient comes into the walk-in clinic and tells the nurse that he would like to be admitted to an alcohol rehabilitation program. Which question is the most important to ask? 1. What made you decide to enter a program at this time? 2. How much alcohol do you usually consume in a day? 3. When was the last time you had a drink? 4. Have you been in a rehabilitation program before? The correct answer is 3. When was the last time you had a drink? Rationale: before someone enters an alcohol rehabilitation program, there should be a medically supervised detoxification. This patient has walked in off the street, therefore, the nurse must determine whether he is at risk for withdrawal symptoms. Withdrawal from alcohol can be life-threatening. The other questions are relevant and are likely to be included in the interview. A patient on the acute psychiatric unit develops neuroleptic malignant syndrome. Which task would be delegated to the psychiatric nursing assistant? 1. Wiping the patient's body with cool moist towels. 2. Monitoring and interpreting vital signs every 15 minutes. 3. Attaching the patient to the electrocardiogram monitor. 4. Transporting the patient to the medical intensive care unit. The correct answer is 1. Wiping the patient's body with cool moist towels. Rationale: a PNA can perform this simple cooling measure with minimal instruction. Neuroleptic malignant syndrome is a rare, but potentially fatal reaction to antipsychotic medication. Symptoms include fever, altered mental status, muscle rigidity, and autonomic instability. The nurse should continuously interpret vital signs, although taking vital signs can be delegated. Assistive personnel in the ICU and emergency department will be familiar with how to attach ECG leads, but PNAs will rarely have occasion to use this equipment, therefore, the nurse should perform this task. The nurse should accompany the patient to the ICU, although the PNA could assist. Which task can be delegated to a medical surgical assistive personnel who has been temporarily floated to the acute psychiatric unit to help? 1. Performing one-to-one observation of a patient who is suicidal. 2. Assisting the occupational therapist to conduct a craft class. 3. Accompanying an older adult patient who wanders on a walk outside. 4. Assisting the medication nurse who is having problems with a patient. The correct answer is 3. Accompanying an older adult patient who wanders on a walk outside. Rationale: medical surgical APs assist patients to ambulate, and they frequently care for older confused patients. Performing one-to-one suicide watch requires experience to recognize behaviors and to immediately alert the nurse and intervene. Assisting the occupational therapist or medication nurse may be possible, but the medical surgical AP is unlikely to be familiar with the behavioral interventions required in these situations. A well-known celebrity is admitted to the psychiatric unit. Several nurses from other units drop by and express an interest in seeing the patient. What is the best response? 1. Please be discreet and do not interrupt the workflow. 2. How did you find out that the patient was admitted to this unit? 3. Please wait. I need to call the nursing supervisor about this request. 4. I'm sorry, the patient has asked that only family be allowed to visit. The correct answer is 2. How did you find out that the patient was admitted to this unit? Rationale: determine how the nurses found out about the patient's admission. This is a serious Health Insurance Portability and Accountability Act violation, and information disclosure must be immediately stopped. Unfortunately for these nurses, administration will have to be notified, but as a professional courtesy, it would be better if they went directly to the supervisor and admitted the error rather than immediately calling the supervisor and reporting them. The emergency department nurse is calling to report on a patient who will be admitted to the acute psychiatric unit. He has a history of bipolar disorder and was in an altercation that resulted in the death of another. He has contusions, abrasions, and minor lacerations. What is the priority question that the receiving nurse should ask? 1. When will the patient be transferred? 2. Will a police officer be with him while he is on the unit? 3. Why isn't the patient being admitted to the trauma unit? 4. What is the patient's current mood and behavior? The correct answer is 4. What is the patient's current mood and behavior? Rationale: knowing the current mood and behavior is the priority, so that the nurse can prepare for physical or chemical restraints, isolation or a private room, and allocation and assignment of staff members. The other questions are also relevant, however, the nurse should be aware that challenging the appropriateness of the psychiatric unit versus the trauma unit requires contacting the nursing supervisor, because the emergency department nurse will not be able to resolve this issue.
A patient who has sickle cell disease is admitted with vaso-occlusive crisis and reports severe abdominal and flank pain. Which of the analgesic medications on the pain treatment protocol will be best for the nurse to administer initially? 1. Ibuprofen 800 mg PO. 2. Morphine sulfate 4 mg IV. 3. Hydromorphone liquid 5 mg PO. 4. Fentanyl 25 micrograms per hour transdermal patch. The correct answer is 2. Morphine sulfate 4 mg IV. Guidelines for the management of vaso-occlusive crisis suggest the rapid use of parenteral opioids for patients who have moderate to severe pain. The other medications may also be appropriate for the patient as the crisis resolves, but are not the best choice for rapid treatment of severe pain. When administering a blood transfusion to a patient, which action can the nurse delegate to the assistive personnel? 1. Take the patient's vital signs before the transfusion is started. 2. Ensure that the blood is infused within no more than 4 hours. 3. Ask the patient at frequent intervals about the presence of chills or dyspnea. 4. Assist with double-checking the patient's identification and blood bag number. The correct answer is 1. Take the patient's vital signs before the transfusion is started. AP education and role includes obtaining vital signs, which will be reported to the nurse before the initiation of the transfusion. Monitoring for transfusion reactions, adjusting the transfusion rate, and ensuring that the blood type and number are correct require critical thinking and should be done by the nurse. A patient with chemotherapy-related neutropenia is receiving filgrastim injections. Which finding by the nurse is most important to report to the healthcare provider? 1. The patient says, "My bones are aching." 2. The patient's platelet count is 110,000 cubic milliliters. 3. The patient's white blood cell count is 39,000 cubic milliliters. 4. The patient reports that the medication stings when it is injected. The correct answer is 3. The patient's white blood cell count is 39,000 cubic milliliters. Leukocytosis is an adverse effect of filgrastim and indicates a need to stop the medication or decrease dosage. Bone pain is a common adverse effect as the bone marrow starts to produce more neutrophils. The patient should receive analgesics, but the medication will be continued. Stinging with injection may occur. The nurse should administer the medication more slowly. The patient's platelet count is low and should be reported, but the level of 110,000 cubic milliliters does not increase risk for spontaneous bleeding. The nurse is providing orientation for a new nurse who is preparing to administer packed red blood cells to a patient who had blood loss during surgery. Which action by the new nurse requires that the nurse intervene immediately? 1. Waiting 20 minutes after obtaining the PRBCs before starting the infusion. 2. Starting an IV line for the transfusion using a 22-gauge catheter. 3. Priming the transfusion set using 5% dextrose in lactated Ringer's solution. 4. Telling the patient that the PRBCs may cause a serious transfusion reaction. The correct answer is 3. Priming the transfusion set using 5% dextrose in lactated Ringer's solution. Normal saline, an isotonic solution, should be used when priming the IV line to avoid causing hemolysis of red blood cells. Ideally, blood products should be infused as soon as possible after they are obtained. However, a 20-minute delay would not be unsafe. Large-bore IV catheters are preferable for blood administration. If a smaller catheter must be used, normal saline may be used to dilute the RBCs. Although the new nurse should avoid increasing patient anxiety by indicating that a serious transfusion reaction may occur, this action is not as high a concern as using an inappropriate fluid for priming the IV tubing. These activities are included in the care plan for a 78-year-old patient admitted to the hospital with anemia caused by possible gastrointestinal bleeding. Which activity can the nurse delegate to an experienced assistive personnel? 1. Obtaining stool specimens for the fecal occult blood test. 2. Having the patient sign a colonoscopy consent form. 3. Giving the prescribed polyethylene glycol electrolyte solution. 4. Checking for allergies to contrast dye or shellfish. The correct answer is 1. Obtaining stool specimens for the fecal occult blood test. An experienced AP will have been taught how to obtain a stool specimen for the fecal occult blood test because this is a common screening test for hospitalized patients. Having the patient sign an informed consent form should be done by the healthcare provider who will be performing the colonoscopy. Administering medications and checking for allergies are within the scope of practice of licensed nursing staff. The nurse is making a room assignment for a newly arrived patient whose laboratory test results indicate pancytopenia. Which patient will be the best roommate for the new patient? 1. Patient with digoxin toxicity. 2. Patient with viral pneumonia. 3. Patient with shingles. 4. Patient with cellulitis. The correct answer is 1. Patient with digoxin toxicity. Patients with pancytopenia are at higher risk for infection. The patient with digoxin toxicity presents the least risk of infecting the new patient. Viral pneumonia, shingles, and cellulitis are infectious processes. After a car accident, a patient with a medical alert bracelet indicating hemophilia A is admitted to the emergency department. Which action prescribed by the healthcare provider will the nurse implement first? 1. Transport the patient to the radiology department for cervical spine radiography. 2. Transfuse factor VII concentrate. 3. Type and cross-match for 4 units of packed red blood cells. 4. Infuse normal saline at 250 ml per hour. The correct answer is 2. Transfuse factor VII concentrate. When a hemophiliac patient is at high risk for bleeding, the priority intervention is to maximize the availability of clotting factors. The other prescribed actions should also be implemented rapidly, but do not have as high a priority as administering clotting factors. A patient is admitted to the intensive care unit with disseminated intravascular coagulation associated with a gram-negative infection. Which assessment information has the most immediate implications for the patient's care? 1. There is no palpable radial or pedal pulse. 2. The patient reports chest pain. 3. The patient's oxygen saturation is 87%. 4. There is modeling of the hands and feet. The correct answer is 3. The patient's oxygen saturation is 87%. Because the decrease in oxygen saturation will have the greatest immediate effect on all body systems, improvement in oxygenation should be the priority goal of care. The other data also indicate the need for rapid intervention, but improvement of oxygenation is the most urgent need. When the nurse is assessing a patient with chronic kidney disease who is receiving epoetin alpha injections, which finding most indicates a need to talk with the healthcare provider before giving the medication? 1. Hemoglobin level is 8.9 grams per deciliter. 2. Blood pressure is 198/92. 3. The patient does not like subcutaneous injections. 4. The patient has a history of myocardial infarction. The correct answer is 2. Blood pressure is 198/92. Epoetin alpha can cause hypertension, and blood pressure should be controlled before administering the medication. Because patients with chronic kidney disease have chronic anemia, a hemoglobin level of 8.9 grams per deciliter is not unusual. Although the nurse could ask the HCP about IV administration of the medication, subcutaneous administration requires a lower dose of the medication and is preferred. Epoetin alpha can cause angina or myocardial infarction, but the risk is highest when hemoglobin levels are greater than 11 grams per deciliter. After the nurse receives a change of shift report, which patient should be seen first? 1. A 26-year-old patient with thalassemia who has a hemoglobin level of 8 grams per deciliter and orders for a blood transfusion. 2. A 44-year-old patient admitted 3 days previously for sickle cell crisis who is scheduled for a computed tomographic scan. 3. A 50-year-old patient with stage 4 non-Hodgkin lymphoma who is crying and saying, "I'm not ready to die." 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. The correct answer is 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. Any temperature elevation in a neutropenic patient may indicate the presence of a life-threatening infection, so actions such as drawing blood for culture and administering antibiotics should be initiated quickly. The other patients need to be assessed as soon as possible, but are not critically ill. The nurse is reviewing prescriptions for several patients who have disorders of the eye. Which medication prescription is the most important to discuss with the healthcare provider? 1. Timolol for open-angle glaucoma. 2. Cromolyn sodium for allergic conjunctivitis. 3. Atropine for acute angle closure glaucoma. 4. Ranibizumab for wet age-related macular degeneration. The correct answer is 3. Atropine for acute angle closure glaucoma. Atropine should not be used for acute angle closure glaucoma. Atropine causes dilation of the pupil, which impedes outflow of aqueous humor and increases intraocular pressure. This action could precipitate or worsen the condition. The clinic nurse is preparing to test the visual acuity of a client using a Snellen chart. Which of the following identifies the accurate procedure for this visual acuity test? 1. Both eyes are assessed together, followed by the assessment of the right and then the left eye. 2. The right eye is tested, followed by the left eye, and then both eyes are tested. 3. The client is asked to stand at 40 feet from the chart and is asked to read the largest line on the chart. 4. The client is asked to stand at 40 feet from the chart and to read the line that can be read 200 feet away by an individual with unimpaired vision. The correct answer is 2. The right eye is tested, followed by the left eye, and then both eyes are tested. Visual acuity is assessed in one eye at a time, and then in both eyes together, with the client comfortably standing or sitting. The right eye is tested with the left eye covered, then the left eye is tested with the right eye covered. Both eyes then are tested together. Visual acuity is measured with or without corrective lenses, and the client stands at a distance of 20 feet from the chart. A visual acuity test is only one part of a comprehensive ophthalmologic examination. The goal of the visual acuity test is to determine clarity or sharpness of vision. A patient has a hordeolum on the right upper eyelid. Which intervention would the nurse recommend first? 1. Apply warm compresses 4 times per day. 2. Gently perform hygienic eyelid scrubs. 3. Obtain a prescription for antibiotic drops. 4. Contact the ophthalmologist. The correct answer is 1. Apply warm compresses 4 times per day. Warm compresses usually provide relief. If the problem persists, eyelid scrubs and antibiotic drops would be appropriate. The ophthalmologist could be consulted, but other providers such as the family physician or the nurse practitioner could give a prescription for antibiotics. For a patient who has multiple risk factors for primary open-angle glaucoma, which sign or symptom should be investigated as an early sign of POAG? 1. Loss of central visual field. 2. Seeing halos around lights. 3. Mild eye aching. 4. Loss of peripheral vision. The correct answer is 3. Mild eye aching. POAG develops slowly, and irreversible damage to the optic nerve can occur before any signs or symptoms are manifested. However, mild eye aching or headaches should be investigated as possible early signs of POAG. Loss of peripheral vision, seeing halos, and loss of central vision are late signs. The nurse is assigned to care for a client with a detached retina. Which finding should the nurse expect to be documented in the client's record? 1. Blurred vision. 2. Pain in the affected eye. 3. A yellow discoloration of the sclera. 4. A sense of a curtain falling across the field of vision. The correct answer is 4. A sense of a curtain falling across the field of vision. A characteristic clinical manifestation of retinal detachment described by clients is the feeling that a shadow or curtain is falling across the field of vision. There is no pain associated with detachment of the retina. A retinal detachment is an ophthalmic emergency, and even more so if visual acuity is still normal. Options 1 and 3 are not specifically associated with a detached retina. The home health nurse discovers that an older patient has been taking her glaucoma eye drops by mouth for the past week. What should the nurse do first? 1. Obtain a prescription for tonometry so that her intraocular pressure can be checked. 2. Try to determine the frequency and the amount that she has been ingesting. 3. Ask her how she decided to take the drops orally instead of instilling them as eye drops. 4. Call the Poison Control Center and be prepared to describe untoward side effects. The correct answer is 2. Try to determine the frequency and the amount that she has been ingesting. Try to find out the amount and frequency that she has been taking the drops by mouth. This information will be needed when calling the ophthalmologist or poison control. A good follow-up question is to try to find out why she is taking the drops by mouth. She may be very confused, or there may have been an error of omission in patient education by all healthcare team members who were involved in the initial prescription. In the care of a patient who recently sustained blindness, which tasks would be delegated to assistive personnel? Select all that apply. 1. Counseling the patient to express grief or loss. 2. Assisting the patient with ambulating in the hall. 3. Orienting the patient to the surroundings. 4. Encouraging independence. 5. Obtaining supplies for hygienic care. 6. Storing personal items to reduce clutter. The correct answers are 2. Assisting the patient with ambulating in the hall, and 5. Obtaining supplies for hygienic care. Assisting the patient with ambulating in the hall and obtaining supplies are within the scope of practice of the AP. Counseling for emotional problems, orienting the patient to the room, and encouraging independence require formative evaluation to gauge readiness, and these activities should be the responsibility of the nurse. Storing items and rearranging furniture are inappropriate actions because the patient needs to be able to consistently locate objects in the immediate environment. The nurse is preparing to administer a beta-adrenergic blocking glaucoma agent. Which statement made by the patient warrants additional assessment and a notification to the healthcare provider? 1. My blood pressure runs a little high if I gain too much weight. 2. Occasionally, I have palpitations, but they pass very quickly. 3. My joints feel stiff today, but that's just my arthritis. 4. My pulse rate is a little low today because I take digoxin. The correct answer is 4. My pulse rate is a little low today because I take digoxin. All beta-adrenergic blockers are contraindicated in bradycardia. Alpha-adrenergic agents can cause tachycardia and hypertension. Carbonic anhydrase inhibitors should not be given to patients with rheumatoid arthritis who are taking high dosages of aspirin. Phenylephrine, an adrenergic agonist, has been prescribed as a topical application for a patient who had intraocular surgery. Although systemic toxicity is unlikely, which adverse physiologic response is the concern? 1. Cardiovascular response, such as hypertension or ventricular dysrhythmias. 2. Renal response, such as urinary retention or urinary incontinence. 3. Respiratory response, such as bronchospasm or mucus plugs. 4. Musculoskeletal response, such as bone pain or joint stiffness. The correct answer is 1. Cardiovascular response, such as hypertension or ventricular dysrhythmias. Topical phenylephrine usually does not cause systemic reactions because the amount of absorption is very small. Cardiac responses are the concern. Other possible reactions may include sweating, tremors, agitation, or confusion.
The nurse is working with an assistive personnel to provide care for Ms. S. before her transfer back to the long-term care facility. In preparation for the transfer, the nurse may delegate the AP to assist this patient with by blank, blank, and blank as needed. Choose the correct options that corresponds to the 3 blank spaces. 1. Getting out of bed. 2. Washing her hands and face. 3. Feeding the patient rapidly and giving her fluids from her tray after every bite. 4. Notifying the long-term care facility that the patient is ready for transfer. 5. Instructing her to pack her belongings as soon as possible. 6. Ambulating to the bathroom. The correct answers are 1. Getting out of bed, 2. Washing her hands and face, and 6. Ambulating to the bathroom. Rationale. Assisting patients with getting out of bed, performing morning care, and ambulating to the bathroom are within the scope of practice for an AP and are appropriate for the nurse to delegate to an AP. If the patient needed assistance with feeding, it would be best to go slowly at the patient's speed. Because this patient is confused, asking her to pack her belongings may be confusing, so it would be better to assist her in packing. The nurse would be responsible for giving the report on the patient and letting them know when she is to be transferred. An 80-year-old female client is admitted to a telemetry unit with an exacerbation of heart failure. She reports a medical history of osteoarthritis, chronic renal insufficiency, and coronary artery disease, including a myocardial infarction and coronary artery bypass surgery 22 years ago. She is alert and her daughter is at her bedside. Indicate which nursing action listed in the far right column is appropriate for each potential heart failure complication. Potential heart failure complication. 1. Acute pulmonary edema. 2. Fatigue. 3. Hypokalemia. 4. Cardiac dysrhythmias. 5. Hypoxemia. Nursing action. 1. Monitor electrocardiogram, oxygen saturation and serum electrolyte levels. 2. Administer oxygen therapy. 3. Administer potassium supplements. 4. Consult a cardiac rehabilitation specialist. 5. Administer furosemide 20 mg intravenous push. Correct answers. 1. Acute pulmonary edema. 5. Administer furosemide 20 mg intravenous push. 2. Fatigue. 4. Consult a cardiac rehabilitation specialist. 3. Hypokalemia. 3. Administer potassium supplements. 4. Cardiac dysrhythmias. 1. Monitor electrocardiogram, oxygen saturation and serum electrolyte levels. 5. Hypoxemia. 2. Administer oxygen therapy. Rationale. Acute pulmonary edema is an emergent situation and requires the nurse to implement care immediately in order to prevent respiratory failure. Rapid-acting diuretics, such as furosemide, are administered via intravenous push to remove fluid from the body, specifically from the alveoli, to improve oxygenation and perfusion. Fatigue is a common manifestation of heart failure, secondary to decreased cardiac output, impaired tissue perfusion, and anaerobic metabolism, and leads to activity intolerance. Consulting a cardiac rehabilitation specialist, who can focus on balancing client activity with symptoms of exertion, will help the client to begin rehabilitation activities while in the hospital. Hypokalemia is a common side effect of diuretic treatments prescribed for clients experiencing pulmonary congestion. Monitoring serum electrolyte levels will assist the nurse in identifying hypokalemia, but the administration of potassium supplements is necessary to ensure that levels remain within normal ranges. Irregular heart rhythms from premature atrial contractions, premature ventricular contractions, or atrial fibrillation are common in clients with heart failure. Cardiac dysrhythmias result from myocardial ischemia, pulmonary hypertension, valvular disease, sympathomimetic agents, and electrolyte imbalances, specifically hypokalemia and hypomagnesemia. The nurse would closely monitor serum electrolyte levels, oxygenation saturation, and other vital signs to identify potential causes of dysrhythmias early. The client would also have continuous electrocardiogram monitoring. Hypoxemia is a complication of inadequate oxygen diffusion, secondary to pulmonary congestion, and impaired cardiac output related to ventricular dysfunction. Providing supplemental oxygen increases the amount of oxygenated blood available to organs throughout the body. Oxygen should be administered via mask as needed to keep oxygen saturation levels greater than 90%. Repositioning the client every 2 hours while in bed improves gas exchange and prevents skin breakdown, but does not address the client's oxygen needs nor the client's fatigue with ADLs. An 82-year-old female client was admitted with a right fractured femoral neck and a left closed non-displaced tibial fracture as a result of a fall. According to her daughter, she has a history of osteoporosis, for which she takes a bisphosphonate, controlled diabetes mellitus type 2, for which she takes an oral hypoglycemic agent, and controlled hypertension, for which she takes a diuretic. The client quit smoking 10 years ago, but enjoys an occasional glass of wine to help her sleep. She lives alone in a senior housing apartment and depends on her daughter for appointments, food shopping, and other errands. Prior to her fall, she was ADL independent. Yesterday afternoon, she underwent right open reduction, an internal fixation of the hip, and had a splint placed on her lower left leg to immobilize the tibial fracture. When entering the client's room, the nurse notes that the abduction device is on the floor. Highlight or place a check mark next to the assessment findings that require follow-up by the nurse. Initial nursing shift assessment findings include: 1. Abduction device is on the floor. 2. Apical pulse equals 92 beats per minute and irregular. 3. Blood pressure equals 166/90. 4. Breath sounds clear in all lung fields. 5. Hypoactive bowel sounds ×4. 6. Restless and picking at bed covers. 7. Right hip surgical dressing dry and intact. 8. Left lower leg splint intact. 9. Right lower leg externally rotated and shorter than left leg. 10. Yells when right leg is touched. 11. No palpable left pedal pulse, right pedal pulse 1+. 12. Left foot cooler and paler than right foot. 13. Finger stick blood glucose equals 288 mg per deciliter. The correct answers are: 1. Abduction device is on the floor. 2. Apical pulse equals 92 beats per minute and irregular. 3. Blood pressure equals 166/90. 6. Restless and picking at bed covers. 9. Right lower leg externally rotated and shorter than left leg. 10. Yells when right leg is touched. 11. No palpable left pedal pulse, right pedal pulse 1+. 12. Left foot cooler and paler than right foot. 13. Finger stick blood glucose equals 288 mg per deciliter. Rationale. The nurse's assessment indicates that the client's surgical hip may be dislocated as evidenced by hip rotation and shortening, yelling when the right hip is touched, and restlessness that could indicate acute pain from subluxation or total hip dislocation. The abduction device was found on the floor, which means that the client may have abducted her right leg. Hip dislocation is a potential complication when a hip prosthesis is used to replace the client's fractured femoral neck. The elevated vital signs could be caused by acute pain. The oxygen saturation is within normal limits and needs to be monitored, rather than followed up as an immediate concern for the nurse at this time. The findings indicate that the left leg may have neurovascular compromise due to absent pulse, pallor, and coolness. In addition, the finger stick blood glucose value is above normal and needs to be improved. Therefore, these findings should concern the nurse and indicate an urgent need to follow up. The nurse is planning care to prevent or detect early complications for a 65-year-old male client who underwent a right total knee arthroplasty today under epidural anesthesia for severe osteoarthritis. Indicate which nursing action listed in the far left column is appropriate for each potential TKA complication. Potential TKA complication: 1. Surgical site infection. 2. Venous thromboembolism. 3. Epidural hematoma. 4. Pressure injury. 5. Surgical site hematoma. Nursing action: 1. Maintain sequential or pneumatic compression stockings/devices while the client is in bed. 2. Assess the client's ability to move her legs and void. 3. Keep the client's heels off of the bed. 4. Provide cold application to the surgical area. 5. Monitor the client's temperature and white blood cell count. Correct answers: 1. Surgical site infection. 5. Monitor the client's temperature and white blood cell count. 2. Venous thromboembolism. 1. Maintain sequential or pneumatic compression stockings/devices while the client is in bed. 3. Epidural hematoma. 2. Assess the client's ability to move her legs and void. 4. Pressure injury. 3. Keep the client's heels off of the bed. 5. Surgical site hematoma. 4. Provide cold application to the surgical area. Rationale: to detect surgical infection early, the nurse should carefully monitor the client's temperature and white blood cell count. To help prevent VTE from venous stasis and decreased mobility, venous return from the lower extremities is assisted by using sequential or pneumatic compression stockings/devices. The client had epidural anesthesia during surgery. To assess whether the spine or its adjacent structures were damaged, the nurse should perform frequent neurological assessments, which includes the ability of the client to move his legs and ability to void. If spinal impairment occurs, the client may have difficulty with motor and voiding ability. The client will be in bed immediately after surgery, so he is at risk for heel breakdown. Therefore, the nurse should position his heels such that they are not on the bed by using pillows or other devices. The client is expected to have right knee swelling and is at risk for a surgical site hematoma. Frequent cold applications can help decrease swelling and decrease the risk for a hematoma.
The nurse is assessing a 75-year-old female client after implementing interventions to manage delirium. For each assessment finding, use an X to indicate whether the implemented interventions were effective, ineffective, or unrelated. 1. Oriented to person and place, effective, ineffective, or unrelated. 2. Becomes combative when touched, effective, ineffective, or unrelated. 3. Recognizes her visiting daughter, effective, ineffective, or unrelated. Correct answers. 1. Oriented to person and place, effective. 2. Becomes combative when touched, ineffective. 3. Recognizes her visiting daughter, effective. 4. Uses her call light appropriately, effective, ineffective, or unrelated. 5. Awake all night but sleeps all day, effective, ineffective, or unrelated. 6. States she has no pain, effective, ineffective, or unrelated. Correct answers. 4. Uses her call light appropriately, effective. 5. Awake all night but sleeps all day, ineffective. 6. States she has no pain, unrelated. Delirium is acute confusion that commonly occurs in older adults and clients who have substance use disorder. In addition to confusion, the client often has problems with his or her sleep-wake cycle and behavioral or emotional manifestations, such as yelling, agitation, and aggression. Being oriented, recognizing her daughter, and using her call light appropriately indicate that her delirium is resolving as a result of appropriate nursing and interprofessional collaborative actions. A 72-year-old male client is admitted to a telemetry unit after a fall at home, secondary to severe weakness in his lower extremities. Past medical history provided by the client includes high cholesterol, aortic valve stenosis, and residual lower extremity muscle pain and weakness secondary to poliomyelitis as a child. His most recent echocardiogram reports moderate heart failure with an ejection fraction of 38%. He is prescribed aspirin and a variety of cardiac medications. The client is diagnosed with rhabdomyolysis. Prescriptions to place a large-bore intravenous catheter and administer normal saline 0.9% at 125 milliliter per hour are received. Choose the most likely options for the information missing from the paragraph below by selecting from the lists of options provided. When caring for a client who has left ventricular dysfunction, the nurse assesses for A. Confusion or B. Nausea, related to inadequate cerebral perfusion, A. Pallor or B. Chest pain, related to inadequate myocardium perfusion, and A. Oliguria or B. Polyuria, related to inadequate renal perfusion. The nurse monitors a client who has heart failure closely for complications of pulmonary congestion when administering intravenous fluids. Manifestations of pulmonary congestion include A. dyspnea or B. stridor, A. crackles or B. fatigues, and A. weight gain or B. tachypnea. If the client experiences acute pulmonary edema, the nurse would place the client in a sitting position and administer A. nitroglycerin sublingual or B. supplemental oxygen, and A. morphine intravenous push or B. furosemide intravenous push. Correct answers. When caring for a client who has left ventricular dysfunction, the nurse assesses for A. confusion related to inadequate cerebral perfusion, B. Chest pain related to inadequate myocardium perfusion, and A. Oliguria related to inadequate renal perfusion. The nurse monitors a client who has heart failure closely for complications of pulmonary congestion when administering intravenous fluids. Manifestations of pulmonary congestion include A. dyspnea, A. crackles, and B. tachypnea. If the client experiences acute pulmonary edema, the nurse would place the client in a sitting position and administer B. supplemental oxygen and B. furosemide intravenous push. An 18-year-old African-American female with a new diagnosis of sickle cell disease is preparing for discharge to home with her parents. The nurse is planning health teaching to help the client prevent a sickle cell crisis event, which could be life-threatening. What health teaching will the nurse include? Select all that apply. 1. Decrease your alcohol intake to 1 drink a day. 2. Avoid overly strenuous physical activities. 3. Avoid temperatures that are extremely hot or cold. 4. Engage in low-impact, low-energy exercise 3 or 4 times a week. 5. Eat a healthy diet that is rich in fruits and vegetables. 6. Avoid high altitudes, such as mountainous areas. 7. Avoid smoking and tobacco use, including vaping. 8. Dress appropriately for the temperature that you are in. The correct answers are 2. Avoid overly strenuous physical activities. 3. Avoid temperatures that are extremely hot or cold. 4. Engage in low-impact, low-energy exercise 3 or 4 times a week. 5. Eat a healthy diet that is rich in fruits and vegetables. 6. Avoid high altitudes, such as mountainous areas. 7. Avoid smoking and tobacco use, including vaping. And 8. Dress appropriately for the temperature that you are in. The nurse would teach the client to maintain a healthy lifestyle and try to avoid stress and stressful situations. For example, engaging in low-impact, mild exercise 3 or 4 times a week and avoiding strenuous physical activities prevents stress on the body and promote health. Eating a well-rounded diet with plenty of fruits and vegetables for vitamins and minerals is also part of a healthy lifestyle. Avoiding tobacco and smoking, including vaping, helps prevent cancers and cardiopulmonary disease. Avoiding temperature extremes and dressing appropriately for the temperature can help prevent stress to the body. Higher altitudes have less available environmental oxygen, which can cause the client with SCD to have difficulty breathing and a sickling and pain event. An 18-year-old African-American female client reports shortness of breath, chest discomfort, fatigue, and fever for the past 3 days. She is admitted to the Medical Surgical Nursing Unit with pneumonia and sickle cell disease. Choose the most likely answer for the information missing from the options provided. As a result of the client's diagnosis of sickle cell disease, the nurse is aware that she could have multiple complications, including acute severe pain periods known as A. acute vaso-occlusive episodes or B. acute chest syndrome. The nurse also monitors for other major sickle cell disease complications, such as A. pancreatitis or B. stroke, A. acute kidney injury or B. leukemia, and A. cholelithiasis or B. sepsis. Correct answers. As a result of the client's diagnosis of sickle cell disease, the nurse is aware that she could have multiple complications, including acute severe pain periods known as A. acute vaso-occlusive episodes. The nurse also monitors for other major sickle cell disease complications, such as B. stroke, A. acute kidney injury, and B. sepsis. Acute vaso-occlusive episodes occur when the sickle-shaped red blood cells clump together and block blood flow to various parts of the body and major organs. As a result, severe pain and organ failure, such as acute kidney injury, occur. Strokes may occur owing to lack of blood flow to the brain or hemorrhage. Infection and sepsis are also common complications due to splenic and immune dysfunction that accompany sickle cell disease. A 38-year-old female client was admitted 3 days ago with severe abdominal pain, fever, and nausea. She was diagnosed with a small bowel obstruction and received general anesthesia yesterday during an exploratory laparotomy to remove adhesions. According to admission documents, the client has a 29-pack-year smoking history as well as chronic obstructive pulmonary disease, for which she takes fluticasone and albuterol, endometriosis, for which she takes ibuprofen and oral contraceptives, and a BMI of 36. The client lives alone and works at a telecommunication call center. The shift report indicates that the patient had a difficult recovery after surgery and has been on bed rest since admission. Initial nursing shift assessment findings include: highlight or place a check mark next to the assessment findings that require follow-up by the nurse. 1. Abdominal incision approximated and healing. 2. Hypoactive bowel sounds ×4. 3. Reports pain in right calf. 4. Nasogastric tube to low continuous suction. 5. Dependent edema in back and hips. 6. Reports incisional tenderness. 7. Left leg is cooler than right leg. 8. Dry unproductive cough. 9. Right lower extremity edema. 10. Reports passing flatus. The correct answers are 3. Reports pain in right calf. 7. Left leg is cooler than right leg. And 9. Right lower extremity edema. The nurse's initial assessment indicates that the client has clinical manifestations of a deep vein thrombosis. Classic signs and symptoms of a DVT include calf or groin tenderness or pain and sudden onset of unilateral swelling of the leg. Extremity redness and warmth and induration along blood vessels are additional signs of a DVT. Other clinical manifestations presented are normal for this client's medical history, the first day after bowel surgery, and bed rest for several days. The DVT findings indicate a change in the client's status, should concern the nurse, and indicate need to follow up.
A 38-year-old female client, while recovering from a small bowel obstruction and an exploratory laparotomy, is diagnosed with a right lower extremity deep vein thrombosis. The client has several questions about her diagnosis and care. Indicate which nursing response listed in the far right column is appropriate for each client question. Client questions. 1. My doctor said I needed to stop smoking. How does smoking have anything to do with my swollen leg? 2. What can I do to help decrease the swelling in my leg? 3. Why are you testing my stool? Nurse's response. 1. Heparin is a blood thinner and can cause internal bleeding. This test helps us monitor for microscopic blood in your stool. 2. Nicotine causes your blood vessels to constrict or narrow, which makes it easier for blood clots to become stuck in the vein. 3. Elevating your legs when in bed and the chair will help. Correct answers. 1. My doctor said I needed to stop smoking. How does smoking have anything to do with my swollen leg? 2. Nicotine causes your blood vessels to constrict or narrow, which makes it easier for blood clots to become stuck in the vein. 2. What can I do to help decrease the swelling in my leg? 3. Elevating your legs when in bed and the chair will help. 3. Why are you testing my stool? 1. Heparin is a blood thinner and can cause internal bleeding. This test helps us monitor for microscopic blood in your stool. Client questions. 4. I read on the internet that I should not move my leg because the clot will dislodge and go to my lungs. Is that true? 5. Why can't this blood-thinning medication be given orally? Nurse's response. 4. Heparin cannot be absorbed by your gastrointestinal tract. It has to be given via IV or injection to be effective. 5. Increasing your activity slowly may decrease your fear. Let's start with getting out of bed and then having a short walk later today. Correct answers. 4. I read on the internet that I should not move my leg because the clot will dislodge and go to my lungs. Is that true? 5. Increasing your activity slowly may decrease your fear. Let's start with getting out of bed and then having a short walk later today. 5. Why can't this blood-thinning medication be given orally? 4. Heparin cannot be absorbed by your gastrointestinal tract. It has to be given via IV or injection to be effective. Rationale. Nicotine causes vasoconstriction which increases the client's risk for a thrombus occlusion. The nurse should take this moment to explain to the client the effects of nicotine on the cardiovascular system, instead of simply stating that it is one of many risk factors. The nurse should teach the client to elevate her legs. Research shows that ambulation does not increase the risk for pulmonary embolus, and therefore the client should be encouraged to walk. Increasing activity slowly will decrease the client's anxiety and fear about dislodging the clot. The nurse should use non-medical terms to explain why a fecal occult test is being done when a client is on heparin and what the test is testing. There is not an oral version of heparin because the drug cannot be absorbed via the gastrointestinal tract, owing to its polarity and large size. A 38-year-old female client was diagnosed with a right lower extremity deep vein thrombosis after surgery. 5 days later, the heparin infusion is discontinued, and the nurse prepares to discharge the client on warfarin. Which health teaching will the nurse include as part of discharge planning related to the client's DVT management and prevention of a new DVT? Select all that apply. A. Elevate your legs on a couple of pillows when in bed. B. Wear knee-high graduated compression stockings. C. Apply prolonged pressure over cuts and nosebleeds. D. Weigh yourself each morning on the same scale. E. Avoid eating foods that are high in fat and cholesterol. F. Increase your activity slowly and rest when needed. G. Take over-the-counter pain medications for mild pain. H. Keep your scheduled appointment at the Coumadin clinic. I. Contact your primary health care provider if your stool is black and tarry. J. If you miss a dose of warfarin, take a double dose the following day. K. Monitor your heart rate and blood pressure daily. The correct answers are A. Elevate your legs on a couple of pillows when in bed. B. Wear knee-high graduated compression stockings. C. Apply prolonged pressure over cuts and nosebleeds. F. Increase your activity slowly and rest when needed. H. Keep your scheduled appointment at the Coumadin clinic. I. Contact your primary health care provider if your stool is black and tarry. K. Monitor your heart rate and blood pressure daily. Rationale. Choices A and B are correct statements. These actions will improve venous return and prevent chronic venous insufficiency. The client should be taught to elevate her legs when in bed and in a chair, and to wear knee or thigh-high sequential or graduated compression stockings for extended periods of time to prevent additional DVT. The client should also be taught the appropriate process for putting on and wearing compression stockings to prevent skin breakdown. Because the client is being discharged on warfarin, an anticoagulant, the nurse should teach the client about bleeding precautions, including applying prolonged pressure over cuts and nosebleeds, and when to seek medical attention when bleeding does not stop. The nurse should also teach the client to monitor for signs of bleeding, which include increase in heart rate, decrease in blood pressure, black and tarry stools, and mental confusion. Dizziness when changing positions may occur if the client is bleeding, and the client may still experience pain in the extremity. Therefore, the nurse should teach the client to rise slowly, increase activity as tolerated, and rest when needed. The client also needs to follow up with a Coumadin clinic for ongoing monitoring and adjustment of dose for a therapeutic effect, INR between 1.5 and 2.0 or higher, as the primary healthcare provider prescribes. The client should be taught to avoid foods high in vitamin K, to avoid medications that increase the client's risk of bleeding, such as NSAIDs, and to take a missed dose of warfarin as soon as the client remembers the dose was missed. The client should never take 2 doses at one time, as this would greatly increase the client's risk of internal hemorrhage. A 6-year-old asthmatic male client, who was presented to the emergency department and reported shortness of breath during a soccer game, is admitted to the pediatric unit. On arrival to the unit, the nurse begins the process for admission. In addition to the information obtained from the emergency department, the nurse notes that the client appears to be anxious and breathes predominantly through his mouth. The nurse notes wheezing throughout all lung fields and slightly diminished breath sounds in the lower lobes. Use an X to indicate whether the nursing actions listed below are emergent or not emergent for the client's care at this time. Nursing action. 1. Place nasal cannula to provide humidified oxygen in response to rescue treatment. Emergent or not emergent. 2. Administer methylprednisolone, per the primary health care provider's prescription. Emergent or not emergent. 3. Titrate oxygen to keep oxygen saturation greater than 90%. Emergent or not emergent. 4. Teach the child to use a pursed-lip breathing technique. Emergent or not emergent. Correct answers. 1. Place nasal cannula to provide humidified oxygen, in response to rescue treatment. Not emergent. 2. Administer methylprednisolone, per the primary health care provider's prescription. Emergent. 3. Titrate oxygen to keep oxygen saturation greater than 90%. Emergent. 4. Teach the child to use a pursed-lip breathing technique. Not emergent. 5. Administer albuterol per hospital protocol. Emergent or not emergent. 6. Allow the child to assume the most comfortable upright position. Emergent or not emergent. 7. Insert a peripheral intravenous line. Emergent or not emergent. 8. Enter the primary health care provider's NPO order into the electronic health record. Emergent or not emergent. 9. Encourage the family to change the child's clothing to promote comfort. Emergent or not emergent. 5. Administer albuterol per hospital protocol. Emergent. 6. Allow the child to assume the most comfortable upright position. Emergent. 7. Insert a peripheral intravenous line. Emergent. 8. Enter the primary health care provider's NPO order into the electronic health record. Not emergent. 9. Encourage the family to change the child's clothing to promote comfort. Not emergent. Rationale. The child needs oxygen delivered in the least invasive but most effective manner. Because the nurse notes that the child is a mouth breather, using a nasal cannula will not be as effective as a simple mask. Resolving the child's respiratory distress, caused by inflammation within the bronchioles, requires a multimodal approach to treatment, including oxygen, beta-2 agonists, corticosteroids to decrease systemic inflammation, and IV fluids. The child needs oxygen delivered in the least invasive, but most effective manner to maintain oxygenation saturation greater than 90%, in order to relieve anxiety and shortness of breath, and to provide adequate oxygenation to vital organs. Although teaching the child to use a pursed-lip breathing technique is a useful strategy for the child to use in the earliest stages of an acute asthma attack to ease anxiety and improve oxygenation, it is not as helpful to treat a moderate or severe attack, especially if the child has never used the technique. Beta-2 agonists bind to smooth muscles of the airway to promote relaxation and decrease bronchospasms. Allowing the pediatric client to select his or her preferred upright position is critical in order to address the child's anxiety, which can cause escalation of respiratory distress, if not handled appropriately. Emergent IV access allows administration of medications and fluids to promote adequate tissue hydration and resolve any acidosis. The child in acute respiratory distress requires frequent or constant monitoring of the respiratory status until the child improves. Adjusting the diet in the electronic medical record is not an emergent action for the nurse. Although this activity might have a calming effect on the child, it is not emergent and can wait until the initial treatment is effective and the respiratory status has improved.
The nurse is assessing a 6-year-old male client who had an asthma attack. Initial actions were performed on admission to stabilize the child's respiratory status. For each assessment finding, use an X to indicate whether the intervention was effective, helped to meet expected outcomes, ineffective, did not help to meet expected outcomes, or unrelated, not related to the expected outcomes. Assessment finding. 1. Oxygen saturation equals to 94%. Effective, ineffective, or unrelated. 2. Child playing quietly on electronic device. Effective, ineffective, or unrelated. 3. Heart rate equals to 121 beats per minute. Effective, ineffective, or unrelated. 4. Respirations equals to 26 breaths per minute. Effective, ineffective, or unrelated. 1. Oxygen saturation equals 94%, effective. 2. Child playing quietly on electronic device, effective. 3. Heart rate equals to 121 beats per minute, ineffective. 4. Respirations equals to 26 breaths per minute, effective. 5. Blood pressure equals to 118/66, effective, ineffective, or unrelated. 6. Temperature equals to 100.4 degrees Fahrenheit, effective, ineffective, or unrelated. 7. Intermittent wheezing in lower lobes bilaterally, effective, ineffective, or unrelated. Correct answers. 5. Blood pressure equals to 118/66, unrelated. 6. Temperature equals to 100.4 degrees Fahrenheit, unrelated. 7. Intermittent wheezing in lower lobes bilaterally, effective. Data suggest that the initial stabilization of the child's respiratory status include an oxygen saturation greater than 90% with or without oxygen, a normalization or reduction of the respiratory rate, and improved lung aeration. The child's ability to play indicates that he is experiencing less shortness of breath, and therefore gas exchange is improving. Changes in the blood pressure or temperature are not relevant to evaluating the respiratory status. The increase in heart rate may be a compensatory mechanism related to decreased gas exchange, or it may be a side effect of albuterol administration. A 47-year-old Caucasian female presents to the emergency department with an abrasion requiring stitches on her head. The client provides an overview of her health history, which includes 22 pack years of cigarette smoking, dyspepsia, chronic obstructive pulmonary disease, cholecystectomy last year, and amputation of the 2 lateral fingers on her right hand due to an accident approximately 4 years ago. The nurse's initial assessment findings include: highlight or place a check mark next to the assessment findings that require follow-up by the nurse. 1. Labored breathing. 2. Denies headache. 3. Oxygen saturation equals to 88% on room air. 4. Unable to read the admission paperwork without her glasses. 5. Pupils equal, round, and reactive to light. 6. Arterial blood gas. pH equals to 7.37. PaCO2 equals to 48. PaO3 equals to 81.2. HCO3 equals to 20.6 milliequivalents per liter. 7. Leaning forward with hands on upper thighs. 8. Chest symmetrically rises with each breath. 9. Respirations equals to 26 breaths per minute. 10. Denies fever and chills. 11. Blood pressure equals to 142/57. 12. Heart rate equals to 95 beats per minute. The correct answers are 1. Labored breathing. 3. Oxygen saturation equals to 88% on room air. 7. Leaning forward with hands on upper thighs. And 9. Respirations equals to 26 breaths per minute. Based on the client's health history, the nurse would be on alert for clinical manifestations of COPD and would follow up on symptoms associated with an exacerbation of this disorder. Rapid, shallow respirations, use of accessory muscles, and orthopneic positioning are cues that the client is having trouble breathing. A client experiencing labored breathing for extended periods of time will become fatigued and oxygenation saturations will decrease, leading to hypoxemia. All of these are signs of an exacerbation of COPD. All the other assessment findings are normal, including the client's arterial blood gas values. The nurse must assess for future acid-base imbalances if the client's breathing status does not improve. A 47-year-old Caucasian female presents to the emergency department with an abrasion requiring stitches on her head and an exacerbation of chronic obstructive pulmonary disease. Her health history includes 22 pack years of cigarette smoking, dyspepsia, cholecystectomy last year, and amputation of the 2 lateral fingers on her right hand 4 years ago. Indicate which nursing response listed in the far right column is appropriate for each client question. Potential complication. 1. Respiratory infection. 2. Dysrhythmias. 3. Activity intolerance. 4. Oral candidiasis. Nursing action. 1. Evaluate laboratory results for acid-base and electrolyte imbalances. 2. Ask the client to rinse her mouth after administering corticosteroid inhalants. 3. Teach the client to drink at least 2 liters of fluid daily. 4. Encourage paced self-care with periods of rest. Correct answers. 1. Respiratory infection. 3. Teach the client to drink at least 2 liters of fluid daily. 2. Dysrhythmias. 1. Evaluate laboratory results for acid-base and electrolyte imbalances. 3. Activity intolerance. 4. Encourage paced self-care with periods of rest. 4. Oral candidiasis. 2. Ask the client to rinse her mouth after administering corticosteroid inhalants. Potential complication. 5. Hypoxemia. 6. Malnutrition. 7. Anxiety. Nursing action. 5. Help the client develop a plan for what she should do when symptoms occur. 6. Administer oxygen therapy. 7. Provide 5 small meals each day. Correct answers. 5. Hypoxemia. 6. Administer oxygen therapy. 6. Malnutrition. 7. Provide 5 small meals each day. 7. Anxiety. 5. Help the client develop a plan for what she should do when symptoms occur. Hypoxemia is a low level of oxygenation in the blood. Reduced gas exchange places a client who has COPD at risk for hypoxemia. Administering oxygen therapy to the client will improve the amount of oxygen exchanged with each breath and help prevent hypoxemia from occurring. Clients with COPD are at increased risk for respiratory infections due to pulmonary inflammation inducing thick and sticky mucus, which results in more bronchospasm. Hydration helps thin secretions so that the client can expectorate them. Dysrhythmias are common in clients with COPD and result from hypoxemia, acidosis, and electrolyte imbalances. Monitoring a client's cardiac rhythm will alert the nurse when a dysrhythmia occurs, but it will not prevent the dysrhythmia. Evaluating laboratory results for acid-base and electrolyte imbalances will provide the nurse with an opportunity to correct imbalances prior to the occurrence of dysrhythmias. Activity intolerance occurs because of respiratory fatigue and dyspnea. Encouraging independence with ADLs and teaching the client to rest periodically will help her to increase respiratory muscle strength, endurance, and activity tolerance. Malnutrition is a consequence of activity intolerance and increased metabolic needs. Although the client would be encouraged to eat high-calorie, high-protein foods including supplements, protein shakes after each meal would not lead to greater ingestion of nutrition. Providing 4 to 6 small meals throughout the day will provide opportunities for the client to eat more and rest between meals. Oral candidiasis is a side effect of corticosteroid inhalants. Rinsing the client's mouth after administering this medication limits the medication's ability to destroy normal flora, which is the body's natural defense against Candida. Clients with COPD become anxious during acute dyspneic episodes. Teaching the client what to do when symptoms begin and assisting the client in developing a writing action plan will help the client maintain control over the episode and decrease the client's anxiety. A 5'8" 265-pound male client is admitted to a telemetry unit with a diagnosis of pneumonia. He is 44 years old, lives with his wife and 3 children, quit smoking 8 years ago after smoking a pack of cigarettes a day for 18 years, and drives a semi-truck long distances for a living. His past medical history includes gastrointestinal esophageal reflux disease, hyperlipidemia, metabolic syndrome, chronic obstructive pulmonary disease, and sleep apnea. He is alert and oriented and reports feeling fatigue and discomfort in the right side of his chest. He is sitting up in a chair, refuses to lie in the bed, and asks for a BiPAP machine, which he uses at home so that he can take a nap. Choose the most likely options for the information missing from the statement below by selecting from the lists of options provided. Chronic obstructive pulmonary disease interferes with airflow and gas exchange, leading to increased A. carbon dioxide levels, or B. bicarbonate levels, A. sputum production, or B. blood pressure, and A. oxygen levels, or B. pulmonary pressure. These physiologic changes increase the client's risk for A. respiratory alkalosis, or B. pulmonary infection, A. hypoxemia, or B. metabolic acidosis, and A. left-sided heart failure, or B. right-sided heart failure. Correct answers. Chronic obstructive pulmonary disease interferes with airflow and gas exchange, leading to increased A. carbon dioxide levels, A. sputum production, and B. pulmonary pressure. These physiologic changes increase the client's risk for B. pulmonary infections, A. hypoxemia, and B. right-sided heart failure. In clients who have COPD, the client's alveoli become inflated, preventing an adequate amount of oxygen to diffuse into the bloodstream and preventing carbon dioxide as a waste product of cellular metabolism to be removed. As a result, serum carbon dioxide levels increase, leading to respiratory acidosis. Inflated alveoli also tend to collect mucus, which increases sputum production and makes the client susceptible to respiratory infection. Pressure within the cardiopulmonary system can lead an end-stage COPD to right-sided heart failure, also called cor pulmonale. A 5'8" 265 pounds male client was admitted to a telemetry unit with a diagnosis of pneumonia. He is 44 years old, lives with his wife and 3 children, quit smoking 8 years ago after having smoked a pack of cigarette a day for 18 years, and drives a semi-truck long distances for a living. His past medical history includes gastrointestinal esophageal reflux disease, hyperlipidemia, metabolic syndrome, chronic obstructive pulmonary disorder, and sleep apnea. He is alert and oriented, refuses to lie in the bed, and states that he uses a BiPAP machine when he sleeps. Which statements will the nurse include in this client's health teaching? Select all that apply. 1. Lie on your back with a pillow against your stomach when performing coughing exercises. 2. Walk 20 minutes each day with periods of rest when you become too short of breath to continue. 3. It is okay to sleep in a recliner or with several pillows tucked behind your back. 4. Make sure your oxygen flow meter is never higher than 4 liters per minute. 5. There are many programs and products that can help you stop smoking. 6. Gargle and rinse your mouth with water after using your fluticasone propionate inhaler. 7. Use of a spacer with a dry powder inhaler improves administration into the lungs. 8. Wait 1 minute before taking a second dose of your albuterol inhaler. The correct answers are 2. Walk 20 minutes each day with periods of rest when you become too short of breath to continue. 3. It is okay to sleep in a recliner or with several pillows tucked behind your back. 6. Gargle and rinse your mouth with water after using your fluticasone propionate inhaler. And 8. Wait 1 minute before taking a second dose of your albuterol inhaler. This client's teaching focuses on self-care and management of his chronic pulmonary disorder. Chronic obstructive pulmonary disease is associated with activity fatigue and dyspnea. Therefore, the nurse teaches the client to build physical and respiratory endurance by walking daily for 20 minutes, with periods of rest as necessary. The nurse would also teach the client energy conservation strategies. Clients often experience orthopnea and anxiety related to dyspnea. The nurse encourages the client to sleep wherever he is comfortable, indicating that it is okay to be more relaxed in a chair or with multiple pillows supporting his back. This helps the client sleep better and may reduce anxiety. Finally, the nurse teaches safety techniques related to prescribed medications. Fluticasone propionate is a corticosteroid, and gargling with water is necessary to minimize complications related to candidiasis. Albuterol may be prescribed as a rescue inhaler, and the client must understand that waiting 1 minute between doses will ensure he obtains the greatest therapeutic effect. A 77-year-old male client with a history of chronic obstructive pulmonary disease is evaluated in an ambulatory care clinic after having experienced urinary hesitancy and post-void leaking. The client's home medications are ipratropium MDI, 2 inhalations 4 times a day, and cetirizine 10 milligrams daily. As a result of a transrectal ultrasound and laboratory testing, the client is diagnosed with benign prostatic hyperplasia and prescribed terazosin, an alpha-1 blocker. Which statements will the nurse include in this client's teaching related to his diagnosis and treatment plan? Select all that apply. 1. Terazosin can decrease your libido. Limit sexual intercourse to once a month. 2. Rise slowly when getting up from a chair or out of bed and sit if you feel lightheaded. 3. Urinate as soon as you feel the urge. Do not hold in your urine. 4. Terazosin may cause high blood pressure. Keep all follow-up appointments. 5. Avoid drinking beverages that contain caffeine and alcohol. 6. Your allergy medications may cause urinary retention. Talk to your primary healthcare provider. 7. Terazosin must build up in your system before you will see a benefit. It usually takes a couple of months. The correct answers are 2. Rise slowly when getting up from a chair or out of bed, and sit if you feel lightheaded. 3. Urinate as soon as you feel the urge. Do not hold in your urine. 5. Avoid drinking beverages that contain caffeine and alcohol. And 6. Your allergy medications may cause urinary retention. Talk to your primary healthcare provider. Terazosin is an alpha-1 blocker. Although it is a selective alpha blocker, the medication can cause orthostatic hypotension, tachycardia, and syncope, especially in older male clients. The client should be instructed to rise slowly to minimize hypotensive episodes and falls. Non-surgical interventions for clients with benign prostatic hyperplasia include decreasing urinary retention and preventing overdistension of the bladder. The client would be taught to avoid beverages that contain alcohol and caffeine, as these increase diuresis, leading to more fluid in the bladder. The client would also be encouraged to void as soon as he feels the urge to prevent bladder retention. Anticholinergic and antihistamine medications can also increase urinary retention, so the client must follow up with his primary healthcare provider for these medications to be reevaluated.
An 89-year-old female client is admitted to a telemetry unit with a diagnosis of heart failure exacerbation. She reports a medical history of osteoarthritis, chronic lymphocytic leukemia, and coronary artery disease, including a myocardial infarction and coronary artery bypass surgery 22 years ago. She is alert and her daughter is at her bedside. Highlight or place a check mark next to the assessment findings that require follow-up by the nurse. The nurse's initial client assessment findings include: 1. Oriented to person only. 2. Clear speech. 3. Follows simple commands. 4. Has sinus tachycardia. 5. Respirations equals to 26 breaths per minute. 6. Oxygen saturation equals to 90% on room air. 7. Breathing labored with use of accessory muscles. 8. Has productive cough with pink frothy sputum. 9. Crepitus in bilateral knee joints. 10. Enlarged bony nodes on hands. 11. Hemoglobin equals to 12.4 grams per deciliter. 12. Hematocrit equals to 39%. 13. White blood cell count equals to 12,000 cubic millimeter. The correct answers are 1. Oriented to person only. 4. Has sinus tachycardia. 5. Respirations equals to 26 breaths per minute. 6. Oxygen saturation equals to 90% on room air. 7. Breathing labored with use of accessory muscles. And 8. Has productive cough with pink frothy sputum. Rationale: coronary artery disease is a common risk factor for ventricular dysfunction and heart failure. Confusion or orientation to person only should alert the nurse to impaired cerebral perfusion, a complication of inadequate cardiac output. Although the client is an older adult, the nurse cannot assume that the client's impaired orientation is related to age, and must complete additional assessments to identify the cause. Sinus tachycardia is a manifestation of compensation for inadequate cardiac output, infection, or other physiologic issues. The nurse must follow up on this symptom based on the client's previous cardiac disease, which increases the client's risk for hypoxemia. An increase in heart rate creates an increased demand for oxygen by the myocardium, which can lead to angina and cardiac arrest. The client's respiratory status also alerts the nurse to complications of heart failure. Tachypnea, decreased oxygen saturation, dyspnea, and labored breathing, and pink frothy sputum are symptoms of pulmonary congestion. When these symptoms are present, the nurse must intervene early to prevent an acute pulmonary edema episode, which could lead to respiratory failure. Crepitus in bilateral knee joints and enlarged bony nodes on hands are manifestations of osteoarthritis, are not acute symptoms, and do not require follow-up at this time. The client's white blood count is a little high, and is likely a manifestation of the client's chronic lymphocytic leukemia. Near the end of the shift, the nurse is admitting Mr. E, an 88-year-old patient, from long-term care to the acute care medical surgical unit. The patient was alert until early this morning and has become confused. His history includes smoking cigarettes for 55 years, but he quit at age 70. He has a history of post-traumatic stress disorder and has had surgery for appendicitis and gallbladder removal. Over the past 36 hours, the patient developed headache, muscle aches, cough with thick clear sputum, and chest discomfort. Vital signs are temperature 101.4 degrees Fahrenheit, pulse 104 beats per minute, respirations 30 breaths per minute, blood pressure 108/62. Assessment findings: warm dry skin, crackles bilaterally with wheezes, tachycardia with normal heart sounds, and a pulse oximetry reading of 89% on oxygen at 2 liters via nasal cannula. The patient does not tolerate lying flat in bed. Admission lab. Complete blood count reveals elevated white blood cell count. Electrolytes: sodium 135, potassium 3.8, chloride 98. Which of the following findings with this patient are factors that increase the risk for a diagnosis of pneumonia? Select all that apply. 1. Patient age. 2. History of PTSD. 3. Smoked cigarettes 55 years. 4. Thick, clear sputum. 5. Crackles and wheezes. 6. Elevated WBC count. 7. Altered level of consciousness. 8. Admission electrolyte values. The correct answers are 1. Patient age, 3. Smoked cigarettes 55 years, 5. Crackles and wheezes, 6. Elevated WBC count, and 7. Altered level of consciousness. Rationale: older patients are at increased risk for pneumonia in the community and in healthcare settings. A history of chronic lung disease is also a risk factor. Assessment findings include the presence of crackles over areas with interstitial fluid, and wheezes are heard if inflammation or exudate narrows the airways. Elevated WBC count is a common finding in older adults, as are changes in level of consciousness. PTSD would not be a risk factor for pneumonia. Generally, with pneumonia, sputum is purulent, blood-tinged, or rust-colored. The electrolytes listed in this case study are all within normal limits.
A 77-year-old male client with a history of chronic obstructive pulmonary disease is evaluated in an ambulatory care clinic after having experienced urinary hesitancy and post-void leaking. The client's home medications are ipratropium MDI 2 inhalations 4 times a day and cetirizine 10 milligrams daily. The client's international prostate symptom score is 15. Past month, indicated, and score, 1. Incomplete emptying. How often have you had the sensation of not emptying the bladder? Score of 1, less than 1 in 5 times. 2. Frequency. How often have you had to urinate less than every 2 hours? Score of 2, less than half the time. 3. Intermittently. How often have you found stopped and started again when you urinated? Score of 4, more than half the time. 4. Urgency. How often have you found it difficult to postpone urination? Score of 3, about half the time. 5. Weak stream. How often have you had a weak urinary stream? Score of 2, less than half the time. 6. Straining. How often have you had to strain to start urination? Score of 1, less than 1 in 5 times. 7. Nocturia. How many times do you typically get up at night to urinate? Score of 2, 2 times. The total IPSS score is 15. The primary healthcare provider prescribes a urinalysis, urine culture, complete blood count, blood urea nitrogen, and serum creatinine levels, post-void bladder ultrasound, and transrectal ultrasound. Use an X to indicate whether the nursing actions listed below are indicated, appropriate or necessary, contraindicated, could be harmful, or non-essential, make no difference or are not necessary for the client's care at this time. 1. Confirm that the client has signed an informed consent for the bladder sonography, indicated, contraindicated, or non-essential. 2. Refrigerate the analysis sample if it cannot be sent to the laboratory immediately, indicated, contraindicated, or non-essential. 3. Ensure the client understands that a transducer will be inserted into his rectum to view the prostate and surrounding structures, indicated, contraindicated, or non-essential. Correct answers. 1. Confirm that the client has signed an informed consent for the bladder sonography, non-essential. 2. Refrigerate the analysis sample if it cannot be sent to the laboratory immediately, indicated. 3. Ensure the client understands that a transducer will be inserted into his rectum to view the prostate and surrounding structures, indicated. 4. Insert an indwelling urinary catheter to obtain a urinary culture specimen, indicated, contraindicated, or non-essential. 5. Ask the client to urinate before performing a urine culture specimen, indicated, contraindicated, or non-essential. 6. Collect the client's urine for a 24-hour period, indicated, contraindicated, or non-essential. Correct answers. 4. Insert an indwelling urinary catheter to obtain a urinary culture specimen, contraindicated. 5. Ask the client to urinate before performing a urine culture specimen, indicated. 6. Collect the client's urine for a 24-hour period, non-essential. Urine specimens become more alkaline when left at room temperature for more than an hour. If the sample cannot be sent to the laboratory immediately, the nurse must refrigerate it, or the specimen will not provide accurate results. Urine culture specimens obtained from a clean catch or urinary catheter are best. If the client cannot provide a clean catch specimen, the nurse may insert a straight catheter or in and out urinary catheter to obtain the sample. The nurse would not insert an indwelling urinary catheter with a urinary drainage system, which is designed to remain in the bladder for a period of time. Indwelling urinary catheters increase the client's risk for an infection and should not be used solely to obtain a urine specimen. A 24-hour urine collection is used to analyze urine levels of specific substances, including creatinine, sodium, chloride, and catecholamine. A basic urinalysis requires only one sample, and the best specimen is collected at the morning's first void. The primary healthcare provider prescribed a serum creatinine level, not a urine creatinine clearance test. Therefore, the 24-hour urine collection is not essential. Bladder sonography is used to measure residual urine in the bladder after the client voids, and therefore the client must urinate prior to the procedure. The bladder ultrasound is completed at the bedside by the nurse or an ultrasound technician. Informed consent is not needed for the procedure. The transrectal ultrasound is generally performed in the interventional radiology department and provides ultrasound images of the prostate and surrounding tissues via a transducer that is inserted into the rectum. The nurse would ensure that the client understands the procedure before it begins.
An 80-year-old female client was admitted to a telemetry unit with an exacerbation of heart failure. She has a medical history of osteoarthritis, chronic renal insufficiency, and coronary artery disease, including a myocardial infarction and coronary artery bypass surgery 22 years ago. The client is scheduled to be discharged today and will move in with her daughter until she feels well enough to go home alone. Which of the following discharge instructions will the nurse provide the client and her daughter? Select all that apply. 1. Weigh yourself each day at the same time, on the same scale to monitor for fluid retention. 2. Contact your primary healthcare provider if you experience cold symptoms lasting more than 3 days. 3. Exertion can cause another episode of heart failure, so help your mother by performing daily activities for her. 4. Notify your primary healthcare provider if you experience shortness of breath or chest pain while resting. 5. Do not use table salt, avoid salty foods, and read labels on all food items to ensure your diet is low in sodium. 6. Do not take metoprolol if your heart rate is less than 80 beats per minute. 7. Heart failure is a chronic condition, so you don't need to be alarmed when you experience heart palpitations. The correct answers are 1. Weigh yourself each day at the same time, on the same scale to monitor for fluid retention. 2. Contact your primary healthcare provider if you experience cold symptoms lasting more than 3 days. 4. Notify your primary healthcare provider if you experience shortness of breath or chest pain while resting. And 5. Do not use table salt, avoid salty foods, and read labels on all food items to ensure your diet is low in sodium. Rationale. Changes in weight over a short period of time indicate changes in the body's fluid volume. Clients who have heart failure are taught to weigh themselves every day to monitor for fluid changes, especially fluid retention. Clients are taught to contact the primary healthcare provider immediately if they experience a rapid weight gain of 3 pounds in 1 week, or 1 to 2 pounds in 1 day, as this is a sign of recurrent heart failure. Clients with heart failure are taught to contact the primary healthcare provider when experiencing cold symptoms, including a cough that lasts more than 3 to 5 days. Symptoms that a client might associate with a cold may be a sign of worsening heart failure. Clients with heart failure frequently experience dyspnea and may sometimes experience chest pain with activity and exertion. Both shortness of breath and chest pain should resolve with rest. Experiencing dyspnea or angina while at rest is a sign of heart failure exacerbation. The client must be taught to contact the primary healthcare provider if these symptoms occur. Although the client may experience shortness of breath with activity, the client is encouraged to maintain independence when performing ADLs. Therefore, the client's daughter should not be taught to perform activities for her mother. Decreasing salt intake will reduce fluid retention by the kidneys. Clients with heart failure are taught to avoid salty foods and table salt and how to read food labels for sodium content. Heart palpitations are a complication of heart failure, and the client should be taught to contact the primary healthcare provider if this symptom occurs. An 80-year-old female client was admitted to a telemetry unit with an exacerbation of heart failure. She has a medical history of osteoarthritis, chronic renal insufficiency, and coronary artery disease, including a myocardial infarction and coronary artery bypass surgery 22 years ago. The client was discharged 2 weeks ago and is with her daughter for her follow-up primary health care provider visit. For each assessment finding, use an X to indicate whether the interventions were effective, ineffective, or unrelated. 1. States she has no shortness of breath since discharge. Effective, ineffective, or unrelated. 2. Has 2+ pitting edema in both ankles and feet. Effective, ineffective, or unrelated. 3. Blood pressure, 134/78. Effective, ineffective, or unrelated. The correct answers are 1. Effective. 2. Ineffective. 3. Effective. 4. States she has no chest pain since discharge. Effective, ineffective, or unrelated. 5. Reports she has more energy when compared to before the hospital stay. Effective, ineffective, or unrelated. 6. Has new onset fungal skin infection. effective, ineffective, or unrelated. The correct answers are 4. Effective. 5. Effective. 6. Unrelated. Rationale. The client was admitted to the hospital with fluid overload, dyspnea, and fatigue, which are all common symptoms of heart failure. Now she reports that she has no shortness of breath and has more energy. Therefore, the interventions work to manage her disease. Her blood pressure is likely within usual parameters for her advanced age, and she has no chest pain, indicating successful management of her health. However, she continues to have some fluid overload, as evidenced by ankle and foot edema. Having a fungal skin infection is not related to the client's current or previous medical diagnoses. An 82-year-old female client is admitted with a fractured left hip. She is scheduled for open reduction and internal fixation of the hip. Her history reveals a diagnosis of osteoporosis, for which she takes a bisphosphonate diabetes mellitus type 2, for which she takes an oral hypoglycemic agent, and hypertension, for which she takes a diuretic. The client quit smoking 10 years ago, but enjoys an occasional glass of wine to help her sleep. Complete the following sentences by choosing the most likely options for the missing information from the lists of options provided. The nurse should recognize that after hip surgery the client will be at a high risk for A. Dementia, B. Infection, C. Stroke, or D. Dysreflexia. Because of A. Osteoporosis, B. Hypertension, C. Diabetes mellitus, or D. Dehydration. And A. Delirium, B. Urinary incontinence, C. Bowel obstruction, or D. Persistent pain. Because of her, A. Persistent pain, B. High blood pressure, C. Hypoxia, or D. Advanced age and hip fracture. The overall goals for her postoperative care will be to prevent A. Fat embolism syndrome, B. Diabetic ketoacidosis, C. Skin breakdown from traction, or D. Immobility complications. And manage her A. Blood pressure, B. Serum glucose levels, C. Emotional behaviors, or D. Persistent pain. Correct answers. The nurse should recognize that, after hip surgery the client will be at a high risk for B. Infection because of C. Diabetes mellitus and A. Delirium because of her D. Advanced age and hip fracture. The overall goals for her postoperative care will be to prevent D. Immobility complications and manage her B. Serum glucose levels. Rationale. Clients who have diabetes are always at risk for acquiring an infection after surgery. Even for clients who are alert and oriented, those of advanced age who experience a hip fracture are at a very high risk for delirium. A large number of clients who have a hip fracture die from complications of immobility, and therefore preventing those complications is a desired postoperative outcome. Surgery is a trauma to the body and affects the ability for most clients to have stable serum glucose levels. These clients are often placed on sliding scale insulin during their hospital stay. The nurse is assessing a 37-year-old female client who underwent a total thyroidectomy yesterday afternoon. Vital signs. Temperature 98 degrees Fahrenheit. Heart rate 84 beats per minute. Respirations 22 breaths per minute. Blood pressure 108/68. Oxygen saturation 100% oxygen via nasal cannula on 2 liters per minute. Laboratory test result this morning. Hematocrit 36%. Serum sodium 141 milliequivalents per liter. Serum potassium 3.9 milliequivalents per liter. Serum calcium 8.0 milligrams per deciliter. Physical assessment findings. Reports throat pain as a 7 on a scale of 0 to 10. Reports hoarseness at times. Breath sounds clear in all lung fields. No respiratory distress. Bowel sounds active times 4. Throat surgical dressing intact. Which of the following actions should the nurse take? Select all that apply. 1. Administer an analgesic as soon as possible. 2. Check the client for muscle twitching and tingling. 3. Request a prescription for oral potassium. 4. Check the client behind her neck for bleeding. 5. Compare the client's preoperative and current hematocrit values. 6. Place the client in a flat position to increase blood pressure. 7. Teach the client that hoarseness is usually temporary. 8. Perform orthostatic blood pressure checks. The correct answers are 1. Administer an analgesic as soon as possible. 2. Check the client for muscle twitching and tingling. 4. Check the client behind her neck for bleeding. 5. Compare the client's preoperative and current hematocrit values. And 7. Teach the client that hoarseness is usually temporary. Rationale. Choice 1 is an appropriate action for the nurse to take because the client reports a pain level of 7, indicating uncontrolled surgical pain. The desired pain level for most clients is 2 or 3. The client's most current serum calcium level is below the normal range of 8.6 to 10.3 mg per deciliter. Hypocalcemia may occur following thyroid removal due to injury to one or both parathyroid glands. Therefore, the nurse should assess for signs of low calcium, including tetany and tingling, especially around the mouth. The client's hematocrit is a low normal, and she could be experiencing bleeding. Therefore, the nurse should check for active bleeding by inspecting and feeling behind her neck and determining if the current hematocrit level is significantly different from her preoperative laboratory value. Temporary hoarseness is not unusual for clients undergoing thyroid removal because the laryngeal nerve can become injured or irritated.
A 72-year-old male client is admitted to a telemetry unit after a fall at home secondary to severe weakness in his lower extremities. Past medical history provided by the client includes hyperlipidemia, aortic valve stenosis, and poliomyelitis when he was 2 years old. His most recent echocardiogram indicates moderate heart failure with an ejection fraction of 38%. He is prescribed aspirin and a variety of cardiac medications. Highlight or place a check mark next to the assessment findings that require follow-up by the nurse. The nurse's initial client assessment findings include 1. Alert and oriented. 2. Blurred vision. 3. Reports lower extremity stiffness. 4. Ambulates with crutches. 5. Sinus rhythm with preventricular contractions. 6. Cardiac murmur. 7. Reports dyspnea with exertion. 8. Bilateral basilar crackles. 9. Blood urea nitrogen equals to 11 mg per deciliter. 10. Creatinine kinase, 1200 units per liter. 11. Potassium 5.2 mg per deciliter. The correct answers are 2. Blurred vision. 5. Sinus rhythm with preventricular contractions. 8. Bilateral basilar crackles. 10. Creatinine kinase 1200 units per liter. And 11. Potassium 5.2 mg per deciliter. The client's ejection fraction is 38%, indicating moderate heart failure. Dyspnea with exertion is a typical symptom of heart failure and would not alert the nurse. If the client reported dyspnea or chest pain at rest, the nurse would need to follow up. Irregular heart rhythm resulting from premature atrial contractions, premature ventricular contractions, or atrial fibrillation may occur in clients with heart failure and should alert the nurse to assess vital signs and serum electrolyte levels. Pulmonary crackles are a sign of pulmonary congestion and should be monitored closely. The nurse must follow up with frequent respiratory assessments and document the precise location of crackles to evaluate if fluid is progressing from the bases to higher levels in the lungs. The client's creatinine kinase and potassium levels are elevated, and the nurse must follow up on them to prevent kidney failure and cardiac arrest. Lower extremity stiffness and ambulating with crutches are post-poliomyelitis manifestations and do not need to be followed up on at this time. The client's cardiac murmur is a manifestation of aortic valve stenosis. This assessment finding would be documented, but there is no follow-up needed at this time. An 18-year-old African-American female client is admitted to the emergency department with report of shortness of breath, chest discomfort, fatigue, and fever for the past 3 days. Highlight or place a check mark next to the assessment findings that require follow-up by the nurse. Additional assessment findings include: 1. Both parents are sickle cell disease carriers, but the client has had no symptoms of the disease. 2. No cyanosis of lips, nail beds, or palms. 3. Reports feeling lightheaded at times. 4. Hemoglobin, 11.4 grams per deciliter. 5. Hematocrit, 36%. 6. Red blood cell count, 3.2 times 10 to the power of 6. 7. White blood cell count, 15,500. 8. Serum bilirubin, 1.8 milligrams per deciliter. 9. Oral temperature, 101.6 degrees Fahrenheit. 10. Pulse, 89 beats per minute. 11. Respirations, 20 breaths per minute. 12. Blood pressure, 98/48. The correct answers are: 1. Both parents are sickle cell disease carriers, but the client has had no symptoms of the disease. 3. Reports feeling lightheaded at times. 4. Hemoglobin, 11.4 grams per deciliter. 5. Hematocrit, 36%. 6. Red blood cell count, 3.2 times 10 to the power of 6. 7. White blood cell count, 15,500. 8. Serum bilirubin, 1.8 milligrams per deciliter. 9. Oral temperature, 101.6 degrees Fahrenheit. 12. Blood pressure, 98/48. The client's parents are sickle cell disease carriers, and the client's blood work shows anemia. She also feels lightheaded at times, most likely because she has low blood pressure and anemia. The client has signs and symptoms of infection, as evidenced by a high WBC count and oral temperature. She also has had shortness of breath, chest discomfort, fatigue, and fever for the past 3 days, which could indicate a respiratory infection. An 18-year-old African American female client reports shortness of breath, chest discomfort, fatigue, and fever for the past 3 days. She is admitted to the medical surgical nursing unit with pneumonia and probable sickle cell disease. Use an X to indicate whether the nursing actions listed below are indicated, contraindicated, or non-essential for the client's care at this time. 1. Initiate oxygen therapy. Indicated, contraindicated, or non-essential. 2. Prepare to give several units of red blood cell stat. Indicated, contraindicated, or non-essential. 3. Administer IV antibiotic therapy. Indicated, contraindicated, or non-essential. Correct answers: 1. Initiate oxygen therapy. Indicated. 2. Prepare to give several units of red blood cell stat. Non-essential. 3. Administer IV antibiotic therapy. Indicated. 4. Refer client to social services for end-of-life care. Indicated, contraindicated, or non-essential. 5. Withhold pain medication until she has a drug screen. Indicated, contraindicated, or non-essential. 6. Keep the head of bed elevated to at least 30 degrees. Indicated, contraindicated, or non-essential. Correct answers: 4. Refer client to social services for end-of-life care. Contraindicated. 5. Withhold pain medication until she has a drug screen. Contraindicated. 6. Keep the head of bed elevated to at least 30 degrees. Indicated. Clients who have pneumonia require respiratory support, including leaving the head of the bed upright and oxygen therapy to help with breathing. Appropriate antibiotic therapy is required to treat the infection. The client's pain needs to be managed regardless of the client's drug usage, either legal or illicit. SCD is not a terminal disease for all clients, and the social worker should not be discussing end-of-life care. Blood transfusion is not needed at this point because the client's hemoglobin and other blood counts are not low enough to require the transfusion, and it may not be effective in a client with SCD. An 18-year-old African American female client reports shortness of breath, chest discomfort, fatigue, and fever for the past 3 days. She is admitted to the medical surgical nursing unit with pneumonia and sickle cell disease. The primary healthcare provider prescribes hydroxyurea to prevent or reduce sickling or painful events caused by SCD. Which health teaching by the nurse about hydroxyurea is important to include? Select all that apply. 1. Be sure to follow up on all lab testing because the drug can lower your red blood cell and platelet count. 2. Because the drug can cause birth defects, be sure to use contraception to prevent pregnancy. 3. After your blood counts improve, you can discontinue the drug. 4. Try to avoid people with infection and public places where there are large crowds. 5. Hydroxyurea has been known to cause several types of cancer, so be sure to follow up with your medical appointments. 6. This drug can cause diabetes mellitus, so report any increased thirst or urination to your primary healthcare provider. 7. Hydroxyurea can cure your sickle cell disease, but you still need to follow healthy lifestyle habits. The correct answers are 1. Be sure to follow up on all lab testing because the drug can lower your red blood cell and platelet count. 2. Because the drug can cause birth defects, be sure to use contraception to prevent pregnancy. 4. Try to avoid people with infection and public places where there are large crowds. And 5. Hydroxyurea has been known to cause several types of cancer, so be sure to follow up with your medical appointments. Hydroxyurea is not a cure for sickle cell disease, but helps to manage events like sickle cell crises. However, the drug has several adverse effects, including bone marrow suppression, birth defects, fetal harm, and cancer. Clients taking this drug are also very susceptible to infection and sepsis, and therefore must avoid others with infection in public crowds. A 38-year-old female client was admitted 3 days ago with severe abdominal pain, fever, and nausea. She was diagnosed with a small bowel obstruction, received general anesthesia yesterday during an exploratory laparotomy, experienced a difficult recovery after surgery, and has been on bed rest since admission. Venous duplex ultrasonography of her lower extremities and laboratory studies are completed. Results from these diagnostic tests include the following data: hemoglobin 17, hematocrit 43%, WBC count 5,500, platelets 165,000, APTT 32 seconds, PT 11.5 seconds, INR 0.9, BUN 15, creatinine 0.6, venous duplex ultrasonography. Conclusion: right lower extremity deep vein thrombosis. The primary healthcare provider prescribes heparin 80 units per kilogram IV bolus, followed by heparin 18 units per kilogram per hour IV infusion. Fecal occult test, morning labs, CBC, PT-INR, APTT, BUN, and creatinine. For each action in the next section, use an X to specify whether the action would be indicated, contraindicated, or non-essential for the client's care at this time. 1. Apply sequential compression devices to bilateral lower extremities. Indicated, contraindicated, or non-essential. 2. Teach the client to avoid foods high in vitamin K. Indicated, contraindicated, or non-essential. 3. Plan to check the client's platelet count in the morning. Indicated, contraindicated, or non-essential. Correct answers. 1. Apply sequential compression devices to bilateral lower extremities. Contraindicated. 2. Teach the client to avoid foods high in vitamin K. Non-essential. 3. Plan to check the client's platelet count in the morning. Indicated. 4. Use ice packs and massage techniques to decrease leg swelling and pain. Indicated, contraindicated, or non-essential. 5. Assess for hematuria and blood in the client's stool. Indicated, contraindicated, or non-essential. Correct answers. 4. Use ice packs and massage techniques to decrease leg swelling and pain. Contraindicated. 5. Assess for hematuria and blood in the client's stool. Indicated. 6. Place client's legs in a dependent position when sitting in a chair. Indicated, contraindicated, or non-essential. 7. Monitor the client's intake and output, indicated, contraindicated, or non-essential. Correct answers. 6. Place client's legs in a dependent position when sitting in a chair, contraindicated. 7. Monitor the client's intake and output, indicated. Heparin-induced thrombocytopenia, a severe reduction in a client's platelet level, is a potential complication of heparin therapy. Therefore, the nurse must monitor the client's platelet levels daily. Internal hemorrhage is another complication of heparin therapy. The nurse must monitor for bleeding in the gastrointestinal tract with fecal occult testing and assessing for visualization of dark and tarry stools, and the urinary tract by looking for visible or microscopic blood in the urine. The half-life of heparin is increased in clients with liver and kidney impairment because heparin undergoes hepatic metabolism and renal excretion. Closely monitoring the client's intake and urinary output, as well as creatinine levels, will help the nurse to identify if the client has any renal insufficiency, which could increase the client's risk for complications. For clients who have a moderate to high risk for a deep vein thrombosis, sequential compression devices should be administered to both lower extremities as a preventive measure. When a client has a positive diagnosis for a DVT, the leg with the clot should not be massaged, nor should a sequential compression device be used, owing to the risk of dislodging the thrombus. The client's legs should not be placed in a dependent position, but instead should be elevated when in bed and a chair to improve venous return. Heparin activates antithrombin, which in turn inactivates thrombin and factor Xa. It has no impact on vitamin K synthesis, and therefore there is no reason for this client to avoid foods high in vitamin K.
A 38-year-old female client was diagnosed with a right lower extremity deep vein thrombosis after surgery 2 days ago. This morning, the nurse reviewed the client's electronic health record to complete a shift assessment. Data from the health record include a prescription from the primary health care provider for warfarin 5 mg orally every day, and the following laboratory results. Lab values: hemoglobin 17 grams per deciliter, hematocrit 44%, WBC count 5,500 cubic millimeters, platelets 160,000 cubic millimeters, APTT 40 seconds, PT 12 seconds, INR 0.9, blood urea nitrogen 16 milligrams per deciliter, creatinine 0.6 milligrams per deciliters. Choose the most likely options for the information missing from the statement below by selecting from the lists of options provided. When assessing a client for complications of a deep vein thrombosis, the nurse recognizes A. bradycardia, or B. shortness of breath, and A. chest pain, or B. confusion, as signs of A. pulmonary embolism, or B. pneumonia, and A. hematuria, or B. nausea, and A. phlebitis or B. ecchymosis as signs of A. hemorrhage or B. dehydration, which can occur as a result of heparin therapy. Correct answers. When assessing a client for complications of a deep vein thrombosis, the nurse recognizes B. shortness of breath, and A. chest pain, as signs of A. pulmonary embolism, and A. hematuria, and B. ecchymosis as signs of A. hemorrhage, which can occur as a result of heparin therapy. Rationale: clients who have a DVT are at high risk for the clot to dislodge and become an embolus, most often a pulmonary embolus. Because the clot travels to the lungs, respiratory symptoms such as shortness of breath and chest pain are common. Excessive bleeding can occur as an adverse effect of heparin, which is an anticoagulant. Common signs and symptoms of bleeding, for which the nurse should assess, include ecchymosis, gross or occult blood in the stool or urine, and epistaxis. The nurse is assessing a 6-year-old male client with a history of asthma, who was brought to the emergency department and reports shortness of breath during a soccer game. The nurse completes a triage assessment with the following data. Highlight or place a check mark next to the assessment findings that require follow-up by the nurse. Temperature: 99.2 degrees Fahrenheit. Heart rate 96 beats per minute. Respirations 32 breaths per minute. Blood pressure 97/66. Oxygen saturation 89% on room air. Health history. Born at 30 weeks gestation. History of asthma. Multiple environmental allergens. Allergic to penicillin. Immunizations are current. Physical/psychosocial assessment findings. Child reports no pain. Child is restless and refuses to lie down. Wheezing in both lungs. Minimal air movement noted in lower lobes bilaterally. Child only nods head yes or no to questions. Parents are at the bedside and providing comfort. Parents deny that the child was exposed to any triggers. Peak flow meter results are less than 50% of child's baseline. Moderate intercostal retractions. Correct answers. Respirations 32 breaths per minute. Oxygen saturation 89% on room air. Born at 30 weeks gestation. History of asthma. Child is restless and refuses to lie down. Wheezing in both lungs. Minimal air movement noted in lower lobes bilaterally. Child only nods head yes or no to questions. Peak flow meter results are less than 50% of child's baseline. Moderate intercostal retractions. Rationale. An elevated respiratory rate, the child's restlessness and refusal to lie down, decreased air movement in the lungs, low oxygen saturation, retractions, and the inability to answer questions beyond nodding his head, are all signs of impending respiratory failure and should be addressed by the nurse emergently. The fact that the child was born prematurely and has a history of asthma also indicate an increased risk of more severe exacerbations or adverse outcomes. Peak flow meter readings for below baseline are strongly indicative of asthma exacerbation that requires immediate intervention. Treatment of the child can still take place whether or not the trigger is known. A low-grade fever is to be expected and is not the priority.
The nurse begins to develop a plan of care and identify teaching needs to review with the parents of a 6-year-old male client with asthma. What would the nurse include in the teaching plan? Select all that apply. 1. The need for allergy testing to identify asthmatic triggers. 2. The need for early identification of symptomatic cough. 3. Home medications, including dosing and precautions. 4. Promoting a calm environment and quiet daily activities for the child during hospitalization. 5. Reassuring the parents that the child will outgrow his asthma. 6. Need for follow-up with pulmonary function testing. 7. Encouraging 4 liters per minute of oxygen for the child. The correct answers are 1. The need for allergy testing to identify asthmatic triggers. 2. The need for early identification of symptomatic cough. 3. Home medications, including dosing and precautions. 4. Promoting a calm environment and quiet daily activities for the child during hospitalization. And 6. Need for follow-up with pulmonary function testing. Prevention or early identification of an impending asthma attack or exacerbation allows for preventive measures to avert the attack. Triggers should be avoided, and a cough or poor sleep is often an early indicator of bronchospasm. The nurse would review home medications to prevent future asthma attack. Encouraging a calm environment helps to minimize air hunger and anxiety. Currently, there is no way to know for sure whether the child will outgrow his asthma symptoms or if it will be a chronic problem. The need to continue with peak flow meter measurements should be part of the health teaching before discharge. A 47-year-old Caucasian female presents to the emergency department with an abrasion requiring stitches on her head. The client is a forklift operator for a local manufacturing company and was involved in a work-related accident. She is alert and oriented. Her speech is clear, but she becomes breathless when answering questions. The client provides an overview of her health history, which includes 22 pack years of cigarette smoking, dyspepsia, chronic obstructive pulmonary disease, cholecystectomy last year, and amputation of the 2 lateral fingers on her right hand due to an accident approximately 4 years ago. 1. Do you have trouble doing things you enjoy due to shortness of breath? 2. Does your employer follow OSHA protocols? 3. What daily activities do you have difficulty performing? 4. Do you have trouble digesting cholesterol and other fatty acid food? 5. Where do you sleep at night? 6. Have you lost weight unexpectedly? 7. Have you ever felt you should cut down on your drinking? 8. Do you enjoy working as a forklift operator? 9. What do you eat and drink on a typical day? The correct answers are 1. Do you have trouble doing things you enjoy due to shortness of breath? 3. What daily activities do you have difficulty performing? 5. Where do you sleep at night? 6. Have you lost weight unexpectedly? And 9. What do you eat and drink on a typical day? Noticing that the client is breathless while sitting in a chair answering questions leads the nurse to assess the degree to which the client's dyspnea affects daily activities. Choices 1 and 3 assist the nurse in collecting information about the client's activity and tolerance, and choice 5 supports the nurse in evaluating if the client experiences difficulty sleeping or orthopnea. Noticing that the client has a BMI of 17.6 leads the nurse to evaluate why the client is underweight. Choices 6 and 9 help the nurse to understand if weight loss occurred, whether or not it was planned, and what the client usually eats each day. Unplanned weight loss frequently occurs as the severity of COPD increases because the work of breathing increases metabolic needs, and clients may experience dyspnea during meals that limits the amount of nutrition eaten. A 44-year-old client is admitted with pneumonia and an exacerbation of chronic obstructive pulmonary disease. His past medical history includes gastrointestinal esophageal reflux disease, hyperlipidemia, metabolic syndrome, chronic obstructive pulmonary disorder, and sleep apnea. He quit smoking 8 years ago after having smoked a pack of cigarettes a day for 18 years and drives a semi-truck long distances for a living. Current assessment findings include vital signs: temperature, 101.2 degrees Fahrenheit, heart rate, 106 beats per minute, blood pressure, 144/79, respirations, 32 breaths per minute, oxygen saturation, 84%, PEF, peak expiratory flow, 52%. Respiratory assessment findings: bilateral wheezing, reports dyspnea, denies pain, thick, tenacious secretions, chest diameter, ratio 1:1. Other assessment findings: bilateral lower extremity pitting edema. Lab and results: hemoglobin, 18 grams per deciliter, hematocrit, 42%, potassium, 4.2 milliequivalents per liter, pH, 7.32, PaO2, 67, PaCO2, 60, HCO3, 22 milliequivalents per liter. For each action in the next section, use an X to specify whether the action would be indicated, appropriate or necessary, contraindicated, could be harmful, or non-essential, makes no difference or is not necessary for the client's care at this time. 1. Obtain sputum samples for culture and sensitivity, indicated, contraindicated, or non-essential. 2. Administer humidified oxygen via Venturi mask, indicated, contraindicated, or non-essential. 3. Provide the client with smoking cessation education, indicated, contraindicated, or non-essential. Correct answers: 1. Obtain sputum samples for culture and sensitivity, indicated. 2. Administer humidified oxygen via Venturi mask, indicated. 3. Provide the client with smoking cessation education, non-essential. 4. Type and cross-match for blood products, indicated, contraindicated, or non-essential. 5. Perform pulmonary function tests after administering bronchodilator, indicated, contraindicated, or non-essential. 6. Administer 20 milliequivalents oral potassium chloride. Indicated, contraindicated, or non-essential. Correct answers. 4. Type and cross-match for blood products. Non-essential. 5. Perform pulmonary function tests after administering bronchodilator. Indicated. 6. Administer 20 milliequivalents oral potassium chloride. Contraindicated. 7. Administer albuterol nebulizer 15 minutes before each meal. Indicated, contraindicated, or non-essential. 8. Implement vibratory positive expiratory pressure therapy. Indicated, contraindicated, or non-essential. 9. Place the client on a 1,200 milliliters fluid restriction. Indicated, contraindicated, or non-essential. Correct answers. 7. Administer albuterol nebulizer 15 minutes before each meal. Indicated. 8. Implement vibratory positive expiratory pressure therapy. Indicated. 9. Place the client on a 1,200 milliliters fluid restriction. Contraindicated. Actions that are indicated focus on obtaining pertinent clinical information to make clinical judgments or interventions to ensure client safety and prevention of complications. Sending a sputum sample for culture and sensitivity will support the advanced practice provider in prescribing appropriate anti-infective therapy, and performing pulmonary function tests before and after administering the client's bronchodilator assist the nurse and provider in judging whether treatments are effective. The client has thick, tenacious secretions that interfere with gas exchange and can cause airway obstruction. Administering humidified oxygen and vibratory positive expiratory pressure therapy thins mucus secretions and assists the client to expectorate unwanted mucus. The client should also be encouraged to drink 2 liters of water daily to assist with the removal of thick, tenacious secretions. Oxygen administration is necessary to prevent or reverse hypoxemia. This client's current PaO2 is 60 and his oxygenation saturation is 84%. Oxygen up to 40% via Venturi mask may be necessary to maintain ideal oxygen saturations between 88% and 92%. The client's serum potassium level is normal, and administration of oral potassium chloride would be contraindicated at this time. The client has already quit smoking and has normal hemoglobin and hematocrit levels. Therefore, smoking cessation education and a type and cross for blood products are not essential.
You can check out my NCLEX course review and study notes. Links will be in the description.